You wait for him? It's 9 a.m. Today is September 22nd, 2020. This is a regular meeting of the Kings County Board of Supervisors. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley is absent. Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Okay, we have 4 members present, 1 absent. We're ready to conduct meeting today. We're going to start off with invocation by Brian Kleinhammer, Kingdom Culture 2.0. Brian, you there?
Good morning.
Good morning.
Let's pray. Father God, as our county leaders meet here today, we affirm that we will not give in to the fear and feelings of helplessness that we have all been experiencing in some measure. We will also not give in to the spirit of hopelessness. We stand by our individual and collective faiths and are listening to your guidance, Lord. Father, we stand together to partner with where you are leading and how you're using both heavenly and human resources to keep us safe. Guide the discussions here today and bring both revelation and wise counsel to the hearts of our leaders as they make decisions that have an impact on all of us. In Jesus' name, amen.
Amen. Y'all follow me in the flag salute. Ready, salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, very good. We'll go to unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or that is with, or any item of interest to the public that is within the subject matter jurisdiction of the board. 2 minutes are allowed. Madam Clerk, do we have anybody online?
Mr. Chairman,
Yes, ma'am.
I have a comment.
Yes.
This is Rebecca Campbell, County Administrative Officer. I wanted to let the board know that I spoke with Mayor Alvaro Preciado last night, and he conveyed to me that he was disappointed that the mobile testing unit is scheduled to be out in Avenal. And the city council took a 5-0 vote not to have it in the city of Avenal at their last meeting. And so he wanted to convey that to the board. Thank you.
Thank you. Any other comments? Let the record note that Supervisor Valley is here in person today.
Mr. Chairman, I asked for a hard copy. There wasn't one in my box. Can I get a hard copy of the agenda?
Yep.
Oh, we have Dave Robinson.
Oh, Dave Robinson? Morning, Sheriff. You on the line?
Good morning. How's everybody doing this morning? Thank you. I appreciate it. My comment is COVID related, but I could wait until later. I could just say it now just to put it on the radar. I know that if that's okay, Mr. Chairman, I'll just say it now.
That's fine. Yeah.
Okay. And so I know a few weeks ago I spoke about, a concern within my staff of some of them having some child care, school care issues, especially now that school did not go back in session. That looks like it's going to last a little while longer. And so I've been trying to research it. I had some great information from Jim Erb. The health director has reached out and said that he's had staff, Sanja, and so other departments might have a similar issue. But I bring mine because I feel it's a little bit unique in our 24/7 operation that we operate here, as you all are very well aware of. And so I did a little research from the last meeting to this meeting, and there was a program for childcare that my staff would have qualified for. That has since ended, and it was being run through the Kings County KCAO. And so I reached out to KCAO staff, and then I actually just had a conversation with Jeff Gardner, the director, just a few minutes ago before the meeting started. And there is a way that it could be set up very easily, according to Jeff, through his staff again, if it were coming from your board's direction. And I know that $2 million was given to KCAO to administer a program that was more geared towards the farm labor community. I understand if they had a COVID exposure and they needed to be, housed separately, et cetera. And, but if a little bit of that money could be used to restart the child care program that they previously ran for essential workers and geared towards my first responders, the application would go through them. They would be the ones that set it up. and they could actually run this program, and it would only be on an as-needed basis by these members that actually filled out the application and applied. So it wouldn't be blanket to every, association member or union member. It would literally be, you have to show proof that you need this service. And so I would like your board to consider doing that when you take up COVID later on, of making one little alteration to that $2 million and set aside about $20,000 of it. I have about a dozen or so, 15 maybe staff members that are paying for childcare out of pocket that this program could be set up for. And I would just ask your board to consider doing that for these first responders. And I'll remind your board that you guys set aside 2 weeks if they had a COVID exposure, but first responders still don't qualify for many of the other benefits that other employees do qualify for under FMLA or FLSA, whichever program it is, because they're deemed emergency workers, first responders, essential workers, whatever the title is. And so I would just ask your board to consider doing that when you take up the COVID topic later on in the meeting. Thank you.
Thank you, Sheriff. That's good information. Okay, anybody else? Pat Sanchez?
Sunset Unified School District.
Okay, good morning, Pat.
Good morning.
Floor is yours.
Okay, I'm on now. Sorry about that.
Okay, you can go ahead anytime you like.
Oh, Pat Sanchez, represented Reef Sunset Unified School District.
Okay, did you have something you wanted to say, or?
Sure, certainly. I just wanted to share a couple of comments. First of all, we're very honored to have a free resource here, and thank the Board of Supervisors for their leadership in providing a free resource to us. I know there's been some question here locally as to, should we do it here, should we not? I did talk with a council member who shared that they had surveyed some people, and as I pressed and asked, well, I'd like to see the data, they had a conversation with a few people with no formal survey. We've actually talked with several parents and several community members who want the resource. We're already probably approaching the number 20 of people we've tested this morning. We have a resource fair on the ground, as I shared in the prior email to you all. So we're happy to have it. We know that as school districts, we are a sanctuary zone for immigration. We have a good relationship with our community, and we are in a good standing point to start taking advantage of this. And I hope that we are able to beat the record of other counties who have done this thus far. But I wanted you to be aware of what's going on. That's all. We'll send pictures.
Thank you, Pat. Appreciate that. I know I got tested yesterday for the second time at the testing clinic here at the county. So it's kind of cool when you go somewhere and someone says, they start complaining about being tested, or, why are you out? And I say, well, I got a negative test. What do you got? So it's something you can keep in your back pocket. You can go and live your life day to day if you just keep yourself healthy and away from others where they might have the virus. So thank you for doing that. Appreciate it.
Mr. Chair.
Thank you guys for your support and your leadership on this.
Is this on?
Okay, thank you. Supervisor Valley.
Is this on? Thank you, Mr. Chair. I'll respond shortly, just briefly, just as it's public comment.
It actually isn't public comment. It's unscheduled appearances. And under the Brown Act, you do have the ability to ask questions for clarification, but your comment should be reserved for board member announcements.
Okay, then I'll ask it. You want my question to the superintendent?
You certainly can ask the superintendent questions.
Okay. Superintendent Sanchez, Supervisor Richard Valley, I represent District 2. Were you on the Avenel City Council meeting 2 weeks ago when the Public Health Director, Ed Hill, made a presentation to the Avenel City Council? After the presentation, the Avenel City Council asked many questions to Mr. Hill and to myself, and then they voted 5-0 and asked and thanked Mr. Hill very respectfully, but voted 5-0 to ask you to ask Ed Hill to send the word to the county that they do not want the National Guard in the city of Avenel. So the question is, were you on that meeting?
I was on that meeting. I was on that meeting. It was a 4-0 vote. And it was, the decision was not so much about directing resources to Avenel as it was to move forward with the free resource. Well, for city council, I don't know about they didn't want it here or not. This is the first I wasn't as aware of that. I was aware that the city, for whatever reason, had some fear about immigration status, et cetera. But what I can tell you, I observed the meeting, and I think that taking advantage of the free resource was important. There was a lot of controversy at that particular meeting. I know the mayor quit in the middle of the meeting, and it was pretty tumultuous. But, you know, I was in and out watching the meeting, doing work while I was at my desk. And at the end of the day, we try to do what's best for our parents and community. And we're not going to get into politicking and politicizing. We're here to serve kids. We're here to serve families. I've been very clear about that with my board. And I had a 5-0 board support to bring the free resource to Avenal. And that's what we have done.
Thank you for answering the question.
Thank you.
Okay, anybody else on the line for comments from the public? Nothing? Okay, with that said, we'll move on to approval of the minutes. Approval of minutes from September 1st, 2020. Approval of the minutes from September 14th and 15th, special and regular meeting. And approval of the minutes from September 16th, 2020, special meeting.
Moved outlined by the chair.
Moved by Supervisor Neves, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Yes. Yes.
Richard Valley,
Aye.
Craig Peterson,
Aye.
Doug Verboon.
Yes. Okay, we'll approve the minutes as presented, and we're going to move on to the consent calendar. All items listed on consent calendar will be enacted by one motion. If one board member chooses to poll one separately and vote on that separately, they can do so at this time. If not, I'll entertain any motion.
Ms. Brandon, Mr. Chair. Same.
Moved by Supervisor Neves, second by Supervisor Peterson. And will, Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Craig Peterson,
Aye.
Richard Fagundes,
Yes.
Doug Verboon.
Yes. Okay, 5 in favor. We've approved the consent calendar as presented. We're going to move on now to item 5A, study session, Public Works Department. Kevin McAllister. Kevin, are you on this morning?
I am. Can you hear me, Mr. Chairman?
Yes, sir.
Okay, thank you. Excuse me, the Integrated Regional Water Management Program was established in 2002, and it is a voluntary statewide planning and implementation program which incentivizes regional collaboration among various water agencies and stakeholders to address multiple water needs on a regional scale and advances the implementation of multi-benefit projects. Proposition 1 funds the Disadvantaged Community Involvement Program. This program objectives are to work collaboratively to involve various stakeholders in integrated regional water management planning efforts. And to that end, Self-Help Enterprises has requested the opportunity to present these two programs to your board. And at this time, I would like to turn the presentation over to Manuel Leon Jr. and Sonia Sanchez, both from Self-Help Enterprises.
Good morning.
Good morning. Thank you for the opportunity to present today. My name is Manuel Leon. I'm a community development specialist with Self-Help Enterprises. And today I'll be presenting with my colleague, Sonia Sanchez. She is a senior community development specialist at Self-Help Enterprises. And together we'll be sharing information about the Integrated Regional Water Management Program, known as the IRWM. Next slide, please, Kevin. So as Kevin mentioned, the Integrated Regional Water Management Program was established in 2002. It is a voluntary statewide planning and implementation program. It is supposed to incentivize regional collaboration among multiple water agencies and stakeholders, and it's supposed to address multiple water needs on a regional scale and advance the implementation of multi-benefit projects. The ultimate aim of the program is to increase water supply and reliability and improve the quality of water in the Central Valley. Next slide, please. So why is the IRWM important? The Integrated Regional Water Management Program is important because it offers a unique opportunity to come together to manage all water needs, to identify common challenges and advance shared solutions. It can also lead to more effective, affordable water solutions and more reliable water supplies. And it also provides funding opportunities for a variety of projects for communities throughout California. And as we know, communities that are proactively planning and investing in water management services have shown resilience. So next slide, please. So how is funding allocated? The DWR, or the Department of Water Resources, distributes grant funding to 12 funding areas around the state. A funding area is defined as a hydrologic region focused on coordinating a strategic approach to regional water resources management. And each funding area is made up of various IRWM regions within the funding area boundaries. Currently in California, there are 12 funding regions, and the IRWM regions collaborate to determine how much funding will be allocated to each category. And these categories are the General Implementation category and the DACII Implementation category, in which DACII stands for Disadvantaged Communities. Next slide, please. And so the Tulare-Kern funding area was awarded $34 billion. And out of those $34 billion, $26.4 million was made available for the General Fund and the DACII Implementation Projects Fund. $23 million was set aside for general implementation projects. And this includes all other types of eligible implementation projects that we will show later. And 3.4 was specifically set aside to help disadvantaged communities and seriously disadvantaged community implementation projects. So 10% of funds have been allocated to DACs and include only those projects that directly benefit a disadvantaged community. And currently in the Tulare-Kern funding area, there are 7 IRWMs. And currently we are residing in the Kings Basin Water Authority. And now I'm going to be handing it off to my colleague, Sonia Sanchez, Senior Community Development Specialist. Next slide, please.
Hello, good morning. As colleague Manuel mentioned, we are in the Kings Basin Water Authority. So the Kings County is the Kings Basin Water Authority. There are 17 member agencies, 42 interested parties, 92 total disadvantaged communities, and specifically in Kings County, there are 3 disadvantaged communities. Those include Hardwick, Armona, and Home Garden. And in the Kings Basin Water Authority, of the disadvantaged communities, 11 previously or currently have participated in IRWM. Next slide, please. So altogether in the Tulare-Kern funding area, there are 344 disadvantaged and severely disadvantaged communities in the 7 IRWM regions. Participation from these communities in the funding area has not been high. As you can see, only 21% have participated in IRWM activities, 7% attended at least one IRWM meeting in 2017 or 2018, and only 14% have a project on the project list. And the project list is where communities can be eligible to receive funding. Next slide, please. So the IRWM program includes the Disadvantaged Involvement Program, which is funded through Prop 1 funds, where the Department of Water Resources states that at least 10% of the funding in each funding area go towards this program. The objectives of this program is to work collaboratively to involve disadvantaged communities, stakeholders, in IRWM planning efforts, increase understanding and identify water management needs of disadvantaged communities, and develop strategies and long-term solutions to address disadvantaged community water management needs. In the Tulare-Kern funding area, they received $3.4 million, and this program began in February of 2018. The activities under this funding program include a needs assessment, a disadvantaged community education and engagement program, project development activities and construction, project management, and grant administration. Next slide. So the Project Advisory Committee is the group that oversees the Tulare-Kern funding area. The Project Advisory Committee's role is to provide key program guidance and decision-making. This group is comprised of 1 member selected by each IRWM group, 1 disadvantaged community member selected by each IRWM region, 1 tribal member, and alternates for each Project Advisory Committee member. In the Kings County, the Project Advisory Committee members include representatives from the Kings River Conservation District, the Armona Community Services District, and the Biola Community Services District. Next slide. Manny, I'll turn it over to you.
The water tool was developed through various organizations, and it is titled the Community Water Needs Assessment Tool. And this is an online resource available to anybody, whether it be a resident or a county official. And this tool was developed to better understand the water management needs of disadvantaged communities in the Tulare-Kern funding area. And so included in this tool is an updated database from the Tulare Lake Basin Disadvantaged Community Study. There is new data and it is constantly updated, and it provides a framework for data storage and organization. And right now we are going to do a short demonstration of the tool. Can you please open up the tool, Kevin?
Bear with me, I'm a little technologically challenged. Are you able to see it now?
Yes, we are.
Okay. Daniel, is there anything that you would like me to zoom in on, say the community dashboard?
Yes. If you could please hover over to the IRWM DACI dashboard. It is the second tab after the overview tab.
Oh, okay.
So in the community water needs assessment tool for the Tulare-Kern funding area, there are various tabs, each showing an abundance of information, and each tab allows you to select a variety of layers and information designated on the right side, either by IRWM region or by county. So we're going to start by selecting the county option. Can you select the county option, please? And then we're going to select the Kings County. And then over on the left side, we're going to select the see results option. So select the see results option, please. And here it is going to show us the Kings County boundaries. And then on the right side, you'll notice that the pie chart is populated with different colors. And using this pie chart, we can see the number of communities that are incorporated or unincorporated. And aside from that, if you click on the map on the region, it will show you a wealth of information of Kings County, which various pages, if you notice, it says 1 of 3. And then now, looking at this tab, you can see that it'll show you information such as the public water system ID, where their water is coming from, whether it's a groundwater source or a surface water source. You can find information such as the median household income, whether this community is incorporated or unincorporated. But another really neat function of this tool is if you, can you please go back to the right side, Kevin, and then scroll down just a little bit so we can populate a PDF document. Each tab offers you the opportunity to generate a formatted report. And this is really simple. You just type in the area that you're interested in searching in the Tulare Lake funding area. So select the option, Kevin.
I'm sorry, which option am I supposed to select now?
The generate formatted community report.
Okay, thank you.
And then after you select that option, a PDF document will be populated on the bottom left-hand screen in the download bar. And you can open this PDF document, and it will give you the information of the communities within the Kings County region. And if we notice at the very top, we have the city of Armona and which water system they belong to. We can see that it is the Armona Community Services District. They have a population of 4,153. They have 1,345 connections. Their water source is groundwater. We can see their water system ID, that the community is unincorporated, and the status of their community. They are a SDAC, or a seriously disadvantaged community. And then at the very end, we can see the median household income, which is about $44,038. Can you please exit the PDF document, Kevin? So as I was mentioning, using this tool, you can use this tool to find water quality data, information on private well communities, and a community needs ranking report. Can you please go back to the presentation, Kevin? All right, and next slide, please. And as I mentioned, this tool is live, it is open to the public, and it is constantly being updated on a monthly basis. And so the tool provides an overview of the Tulare Lake funding area, an integrated regional water management disadvantaged community dashboard, which is what we just looked at. But you can also use it to look at the community water quality dashboard, which helps provide water quality information, such as the different types of nitrates or chemicals that can be found in groundwater. A community needs ranking report, which provides a PDF document of why a community is based as being having no need of help or being in serious need of funding and water. And then a wastewater facility, which allows you to populate where wastewater facilities are located in the Tulare Lake funding area. And then the final tab, resources, which is just a tab to show you where all of the information is coming from, or if you have more questions and would like to do further investigation. And each tab can be used to generate a PDF document of information that is displayed. And then now I'm going to hand it back to my colleague, Sonia Sanchez. Thank you so much for your help, Kevin.
Thank you, Manuel. As mentioned, one of the activities of the Disadvantaged Community Engagement Education Program is focusing on improving the understanding of community water needs and IRWM. This program encourages the disadvantaged community participation and engagement in IRWM activities. And activities included under this program include an assessment of past and present DAC engagement, community water needs assessment, outreach and engagement recommendations, developing IRWM educational tools, project development and technical assistance, and building long-term water management capacity. In the chat box for this presentation, I included a link to our website where it includes more information about these activities and also has our educational tools. Here on the screen on the right-hand side, this is one of our fact sheets for the Kings Basin Water Authority. So it's a get to know your fact sheet, and it has all the information for the IRWM program all in one place for this region. Next slide, please. The other activity that's included for the funding area is project development activities and construction. For this activity, $2 million was available to assist disadvantaged communities develop competitive water projects. These projects include application assistance for round 1 IRWM implementation, feasibility studies, environmental documents, engineering, construction, system upgrades, and land acquisition. In round 1, which took place last year, the project advisory committee split the funds by allocating $250,000 to each of the 7 IRWM regions, and they had a pot of $250,000 that was competitive within all of the regions. For both of these funds, the project advisory committee and the disadvantaged community representatives reviewed and approved which projects to allocate funding to. A little bit later in the presentation, I will show you what those look like. For round 2, it is expected to be announced near the end of this year or the beginning of next year. So there will be more funding available for disadvantaged communities. Next slide, please. Here are the present funding opportunities that were funded through round 1 of the funding round. So there was 2 types of categories. One was project development and one was implementation. For the implementation, this is the construction phase of the project. And in the Kings funding area, you will see that Sultana Community Services District received $142,000 for a stormwater project together with their neighboring community of Munson. Under the planning phase of the project, this includes preparing an engineering report and budget. And so these were the 2 types of funding categories available and the projects that got funded under each of these. Next slide, please. So these are the projects that were approved for project development funds under previous funding rounds for IRWM. This was under Prop 50 and Prop 84. As an example for the Kings Basin, which again, Kings County is a part of, one example, there's 3 here, the East Arosi, Malaga, and City of Delano all received funding. The City of Delano received funding for a spreading facility. There was also Malaga received funding for a well replacement, and East Arosi received funding for a well and pipeline design and environmental documents project. So as you can see, overall, the IRWM program has helped disadvantaged communities address vital water needs and also has improved water resources through a variety of projects. Next slide, please. And before we conclude the presentation, I did want to share that there is an upcoming free 3-day disadvantaged community and tribal involvement lessons learned summit for the IRWM program. This is taking place October 8th, 13th, and 14th from 8:30 to 1 p.m. each day. This summit will share strategies and highlight best practices and resources for developing and engaging marginalized community in water management planning. I'm going to go ahead and put the information in the chat box, so that will include a link for more information and to register if you are interested. But if there are any questions, Manuel and I are available to answer any questions if we do have time.
Thank you, Sonia and Manuel. Do we have any questions or comments? We have one comment. Supervisor Peterson.
Yeah. Thank you, Mr. Chairman. Thank you for the presentation today, Manuel and Sonia. Obviously, these are, important funding tools to communities. But the overall impact of the story is also important to me as well. And I was just curious, as we're generating this data, there are a lot of things that go into affecting water supply and the history of that. And as you build this level of understanding and relationship with groundwater, and as you've stated in your documents, build long-term water management and capacity, is part of the changes to water policy in the state anywhere in this document?
No, this program doesn't deal specifically with policy. It really deals more with implementation projects. So that is separate and it's not really included as part of the activities of this program. But our organization, Self-Help Enterprises, is involved in policy and advocates for policies that help disadvantaged communities have access to clean and affordable drinking water.
Right. Well, I just think the relationship between the SIGMA process that's taking place, the long-term changes in water policy in the state truly, and have affected probably no place more negatively than the Central Valley. And I think it's an important item to have as information and background as you build this level of knowledge in the relationship between water supplies and water availability. But thank you.
Sure. I just want to add a quick comment. Yes, our organization does support SIGMA efforts as well. And actually, in that link that I just included for signing up for the 3-day summit, there will also be a webinar about successful collaboration between IRWM and SIGMA, and that takes place this week, September 23rd from noon to 1:30 p.m. So if anybody's interested, that's also a free webinar that is available.
And the webinar address is on your site at the Self-Help Enterprise?
I just put it in the chat box for this meeting.
Okay.
Yep.
Okay, well, thank you. Any more questions or comments? Well, thank you very much. Thank you, Kevin, for bringing us to our attention. And thank you, Manuel and Sonia, for your presentation.
Thank you.
Working with you in the future.
Thank you so much for having us today.
Thank you. Okay, we're going to go on now to regular agenda items, and we're going to start off with the fire department. Bill Lynch and Amanda Verheege.
Good morning, Mr. Chairman and members of the board. Can you hear me all right?
Sound fine.
Great, thank you. This is Amanda Verheege, Emergency Services Coordinator with the Kings County Fire Department and Office of Emergency Services Division. I'm bringing before your board today an item to accept the fiscal year 2020 Emergency Management Performance Grant COVID-19 supplemental funding. From here on out, I'm going to use the abbreviation EMPG since Emergency Management Performance Grant is a bit of a mouthful. But special funding allocation is a special pot of money to supplement the EMPG funding, but is earmarked in response for emergency management COVID-19 emergency management costs. Ordinarily, EMPG requires a dollar-for-dollar match, but the states absorb the matching costs for local operational areas with populations of less than $500,000 by providing an in-kind match for their own resources for just this particular allocation. So the $86,732 allocation will be added to the 24300 budget unit. This is a reimbursable grant, and all expenditures are to be administered by the OES division. A reimbursement request will be sent to Cal OES for approval, and OES will process the reimbursement funds. Kings County OES is proposing using this funding to help build better logistical receipt and storage capabilities for emergency management. The plan for this funding is to convert the building next to the fire department headquarters into a more efficient space for receiving and distributing response goods. The last several emergencies we've had have resulted in the need to store goods such as PPE, personal protective equipment, or water, and the storage has been difficult or troublesome to manage at times. There have been times when we've had to leverage partnerships with private entities or short-term limited government spaces that often can't hold goods for longer terms, which makes it difficult to stockpile for longer duration events such as drought when we were moving a lot of water or water supply disruptions, or in this case, COVID-19, when we're holding a lot of personal protective equipment. So expanding our resource capabilities through this project will allow the operational area more space to prioritize and store those items at a reduced cost for future events. This year, OES procured a forklift to augment logistical support needs for the op area, and this would be a great complementary project to the forklift project by increasing the available space outside of a cleared bay we already have in this area for future needs. This area also has an added corral where the health department already stores other equipment, and it's also ideal because it includes bay doors and large items can be moved in easily or out. It can handle pallets, other things like that. This project meets the prioritization for funding from the Cal OES Notice of Funding opportunity in reviewing, modifying, and/or executing logistics and increasing capabilities to stockpile and provide necessary resources to stabilize lifelines. It also meets our ability to develop and enhance existing capabilities related to mitigation activities for slowing the spread of COVID-19 in support of personal protective equipment acquisition and the logistical support to execute those deliverables. The fiscal year 2020 EMPG COVID-S funding performance period extends to October 26, 2021. It has a 21-month performance period. The resolution for this grant has already been reviewed and approved by County Counsel's office. And for the sake of time this year, it also includes approval for other Kings County OES grants for the fiscal year. We'll be coming before your board at later dates with those other agenda items for those other grants, but each future agenda item will reference this approved resolution to submit upon approval by the Board of Supervisors for future items instead of waiting for new resolutions to be processed. At this time, we're asking for the following approvals: that you authorize the fire department to accept the fiscal year 2020 EMPG grant COVID-19 supplemental, that you authorize the county fire chief to sign all the grant documents, adopt a resolution designating the fire chief, county administrative officer, or the purchasing manager as authorized signatories for execution of grant documentation, and you adopt the budget change that goes with this item. I'm ready to answer any questions you may have at this time.
Thank you, Amanda. Any questions or comments for Amanda? Moved by Supervisor Fagundes, second by Supervisor Neves. Madam Clerk, please call the roll.
Yes.
Aye.
Yes.
Aye.
Yes.
Okay, the item is approved, 5 in favor. So thank you, Amanda, for the presentation. Good luck.
Thank you.
Okay, we'll go on now to item B, Health Department. Ed Hill.
Morning, Mr. Chairman, members of the board, Ed Hill, Public Health. Today, I'm here to provide your board with an update on the status of our mobile testing efforts in the county. I would once again like to begin this presentation explaining why testing is important for us moving forward through this COVID-19 pandemic. Testing gives us the opportunity to understand the true spread and nature of the virus. Surveillance testing also notifies us of any possible outbreaks that may be occurring within the county. Testing of asymptomatic patients can help decrease our testing positivity value. If we're only testing individuals that have symptoms, then our testing positivity value will remain high. 3 weeks ago, the governor announced a testing metric where counties will be held accountable for not testing at least the state's average or median. If we test more, they will give us credit and decrease our scores, but if we test less, we will be penalized, and this will increase our score. Last week, because we tested more than the state's average, the state adjusted our new cases per 100,000 from 8.9 to 7.5. And today, this data will be updated, and we will again get our new cases per 100,000 adjusted from 8.5 to 7.2 because we continue to test higher than the state's average. It also allows us to conduct COVID-19 or connect COVID-19 positive individuals with available resources and services to assist them with isolation and quarantine. Also schools without waivers, but are offering some in-person instruction through the use of small cohorts, which pretty much all the schools in Kings County are doing, require that districts and schools test staff periodically as testing capability permits and is practicable, with the recommended frequency of testing all staff over a 2-month period. Finally, the state will likely very soon introduce another metric called the equity metric. We brought up this metric at the last meeting, which counties will need to show focused testing, case investigation, and contact tracing in underserved or hard to reach areas. And if we don't, the state will apply an adjustment that will again affect our new cases per 100,000 negatively. At the last board meeting, I provided an update on the county's RFP process for mobile testing services that are being offered through a coordinated effort with the National Guard and the California Office of Emergency Services. Another federal testing resource being offered by the National Guard in coordination with the California Emergency Medical Services Authority, and a final, although not recommended, option of the Kings County Department of Public Health conducting testing. At that time, it was your board's decision to continue with the federal mobile testing unit and evaluate its progress. As a reminder, this mobile asset is being provided by the feds, National Guards, and coordinated through the California Office of Emergency Services, and comes equipped with a 30-foot RV, pop-ups, equipment, supplies, medical staff, and administrative support by the National Guard. This resource has the ability to register and test 300 to 500 patients a day. The tests are PCR molecular nasal swabs that are conducted on a supervised self-swab process. Test results are provided within 3 to 5 days. Individuals can register or pre-register or walk up. Minimal information is collected and no insurance information is needed. It's completely free. They will ask for an email address so that they can send the results to, but if they don't have one or if you don't want to give them an email address, they create a user account and password for you so that you can check your results on your own. We're allowed to move the unit anywhere we need them in the county, and they are working Saturday through Thursdays so that we can cover the weekend. It is hopeful that public health staff will be able to take over the administrative portion of this resource at the end of September and keep the medical staff, RV supplies, and other resources until the end of December. The mobile unit has been deployed for a week now. Last Monday, they were at the county complex and completed 101 tests. They were at Lemoore High School on Tuesday and completed 69 tests. Wednesday, they were at Hacienda Post-Acute and did 92 tests. Thursday, they were at the Corcoran train station and completed 44 tests. They were off Friday. Saturday, they were at the Hanford Mall and completed 62 tests. Sunday, they were at the Coyote Center at DACII and completed 12 tests. Yesterday, they were again at the county complex and completed 68 tests. The units at Avenel High School today, as discussed earlier, they will be at Hacienda Post-Acute on Wednesday, Lemoore High School on Thursday, off again on Friday, and at the Corcoran train station on Saturday, and again at the Coyote Corner on Sunday. The schedule can be found on our website, and we're working with local faith-based organizations, CBOs, and local business to get the word out. And the reason we're doing this is we have to keep the resource busy in order for us to keep the resource here. The other federal resource, we were unable to identify a location for the mobile testing resource coordinated through the Emergency Medical Services Authority for a couple reasons. One, the turnaround time was extremely short. We only had a couple of days. The resource was only going to be here for 3 days, and we couldn't get some of the basic questions answered about the resource, such as how often can it be moved? Will we have to provide staff? Will we need to provide supplies? Is there any pre-registration information and things along those lines? Finally, and again, not a recommendation, the Public Health Department currently has the ability to test using our current mobile unit, but this would require we execute a contract with a private lab, as our regional lab continues to restrict the number of samples that we can submit through normal channels. They have increased and relaxed the past restrictions from 30 samples a day and only symptomatic individuals to 60 samples a day, but with a doctor order. Again, I would prefer that we keep this as a backup to any of these other resources, as we've done in the past, as well as remember that we're entering into flu season. We'll likely be using this resource to complement any other mobile testing to provide immunizations and flu shots. Therefore, it's recommended your board receive and file this report and take appropriate actions as deemed necessary. This concludes my report, and I'm happy to answer any questions.
Thank you, Ed. On mobile testing, the numbers we have so far, are those high enough to where we can keep the facility after September's over?
We're working hard with Cal OES, the coordinator from that group, to make sure that they understand that we do have bigger and broader plans in the future. We have not been given any negative responses to that. In comparison, the 101 tests that we did the first day at last Monday at the county complex, when we first opened the OptumServe site at the day reporting center, they only did 21 tests that first day, and then their numbers continued to increase. And I believe as long as we continue to keep the schedule full, we continue to increase the numbers, we have a decent chance of keeping the resource here until the end of December.
Is there anything that's going along with it? I know I've tested twice. I tested last Monday and yesterday. But we need to, I think at the time when we go test, we should remind people when they're there or hand them something that, you need to come. This is something that we're going to have to do continuously until they have a vaccine. To remind them that this should be something they put in their weekly schedule or monthly schedule to keep tested often. Is there something we can do to get that word out?
Yes, we can continue to work with our partnering agencies. In addition to that, we're likely going to print appointment cards, to indicate that you've been tested on this date. You should return for another test in 7 days and give them a date on that card, similar to what you would receive at a doctor's appointment, as well as continue to promote this process throughout the county through our regular channels.
And I know that if you have a cell phone, you can do your appointment. You can do it's called like a tickler or something. You can send out it's time for your next visit. Is there some way we can do that too with the phone number we have on site with the testing facility?
We can for individuals that want to opt in. We use a similar app called Remind Me with our WIC appointments to remind them of appointments and things of that nature, and we can consider deploying something like that as well.
Hey, thank you. No, I think it's a good deal. I mean, I'm looking for 2 weeks off, but I keep testing negative, so I'm trying.
How does that test work, Mr. Chair? You actually stuck the nasal swab in your nose or in
It's
your
like
mouth?
a little pipe cleaner on a plastic swab, and it has a breaking point on it. So they hand you the tube that has the solution in it. You take the swab, they watch you, and they tell you where to stop, and you twirl it 3 times in your nostril, right and left side, and then you take it and you put it in a little holder, break off the tip, put the jar back on it, put it in a baggie with your paper that has your name and contact information on it. It's not touched by anybody but yourself. You hand it over, and in return, they'll hand you a mask, whatever things you need for the future. So it didn't, I mean, I'm used to having my fingers in my nose, so it's not a big deal, but it didn't seem that evasive. It just, you go up there and I could have got further, I guess, but it's unusual to have something that far up in your nose.
Yeah.
So I was able to get a big burger out yesterday, so we put that in a jar, saved it for later. So any questions for Ed? Comments?
Well, Mr. Chair, I have some questions.
Okay, Supervisor Valley?
Mr. Hill, the numbers that you put out from last week, the 101, the 69, the 92, the 44, the 62, and the 12 at the DACII. Last week on this agenda item, the chairman had indicated, and I don't know if the math has changed, but 200 per day would what we would need to test at these sites in order to be successful. Yesterday on a call, I heard you label this program, these numbers successful 2 or 3 times. You used that word. Today, these statistics that you're putting at these different locations, would you still label this program as being successful? And I ask this in the terms of the number of people that you're drawing at these events to be tested.
Supervisor Valley, through the chair, I'm not I can't recall the 200 tests per day in order to be successful conversation. I would label what we've seen so far in comparison to other new testing sites established and the ones that we have conducted ourselves, being the Public Health Department and other jurisdictions, as being higher and more optimistic. Again, it would be better if we could get the numbers much higher, but I would consider this successful for the launch of this resource for the first week.
And my comment on the 200 was on the RFPs we had, it seemed like they had an average number of $26,500 a day as a minimum cost. That was at 200 tests at $175 per test.
Mr. Chair, last week Supervisor Valley recused himself from participating in discussions regarding the RFP. I would just like to confirm whether Supervisor Valley intends to do that today.
I do not plan to recuse myself today.
So that was where I got by 200 a day was from, if we were paying for it, that would be the minimum we could have. Any more than that, we would be saving money, but the free testing is not a cost to us. So 200 would be great. But if we were going to use this as a baseline, then we're nowhere near going out for RFP because we couldn't cover our cost. We would lose money every day at 100 tests. We would need to we're at half capacity at that time.
Yes.
That's just my own figuring in my head, whether it's right or wrong, it was my numbers.
Yes. And for clarification, this is the time, right? We're under RFP, all of that. The chairman asked if any board members had any comments. If I didn't comment, we were just going to move forward. Is that what you expect?
Move forward with the RFP.
No, the next agenda item.
There is a question regarding board direction related to the RFP.
And now is the time.
It may or may not. I think now is the time to ask questions of the Director of Public Health regarding his report. But I would renew my question to you if we do, in fact, when we do, in fact, get to a discussion of the RFP, whether you intend to recuse.
No, I don't. And I regret doing that last week because the rules only apply to Supervisor Valley. They don't apply to nobody else. And I'll have an example of that for you shortly, based on something that you've already done today, too. Mr. Chairman, I'm not here to be negative. As it relates to RFP, you might recall that I wasn't supportive of going to RFP in the first place because Mr. Hill and I had spent about a month working out a plan to go after, to mitigate the outbreak and the populations that Ed Hill identified to us back on July 14th, being the dairy workers, the ag sector, essential workers, which we all know means farm workers. That's all that I'm here for. And it's specifically why I came here today, because as I mentioned on the Zoom meetings and everything, I felt that we were all getting out of touch and I felt that I wasn't a part of this. And I want to be a part of this. I've earned that. We have all earned that here. And so I just want to start by saying, over the 12 years that I've been here, many of us have had, we've disagreed on some issues as elected officials, but to this day, there still isn't one of you that I would not go out and have a beer with, as long as you're buying. That being said, I have nothing but respect for you. We've all been elected to be put here. So all I'm trying to do is be helpful here. So the next question, Mr. Chair, to Mr. Hill is, and before I even ask it, I'm not against the National Guard issue. Last week when I recused myself, I think there were some opinions that were formulated. So to represent myself, the city of Corcoran, my hometown, I don't have an issue with it being there. I'm happy to hear that 44 people showed up last week. We can talk about the Avenel issue later. And again, I don't want to be too negative on that, but I'm going to save that for an upcoming agenda item. But as far as the city of Corcoran, I'm not saying anything about them being there. I will note that the mayor of the city of Corcoran and the city manager reached out to Mr. Hill and myself and asked us to be on their Corcoran City Council meeting tonight. So I want to be transparent about that, and that's at 5:30. The question is, Mr. Hill, so going back to July, when you told the board publicly and several times since then that we do have the outbreak in those areas. So and then you asked for the $1 million or so in your CARES Act funding budget for mobile testing. And so as things have been muddied up, as you fast forward to today, but going back to that day, we were all on a mission just to clear up these issues so we could open up and get our economy open and our schools open back up, our kids back to school, all of that good stuff. But you said that we have an issue that we need to take care of. So I just want to ask you simply, is the mobile testing to date, is it helping with the outbreak of the infections in those areas?
Supervisor Valley, through the chair, all testing will be helpful to this outbreak countywide. Of course, we would like to see this mobile testing be successful so that we can provide greater outreach, as I discussed in the past, over the weekend and in the hard-to-reach areas.
Okay, but can you answer my question? The question is a mobile testing helping to mitigate the populations that you identified that the county has an outbreak in? You as a public health director, I'm asking for your opinion for the public.
Yes, it is, as long as we can get it to the areas where it's needed.
Okay, so how many farm workers showed up in the city of Lemoore? How many dairy workers showed up at the city of Lemoore?
We will have to pull that data.
Do you know if one of them, 10 of them, has shown up?
No, we don't know that. We will have to pull that data.
How many farm workers showed up at your event in the city of Corcoran?
Again, we have to pull that data.
Okay, so I'm trying to have a discussion with the public health director, and he doesn't want to be transparent here. And so, again, Mr. Chairman, I'm not here to be negative. I'm trying to figure out how we can move forward here with it. And council can try to apply rules to me that she's going to apply to anybody else, but I'm going to get this part out. Mr. Chairman, I'm ready to move forward. If the board wants to drop the conversation of the RFP, I'm fine with that. I would only ask that we leave the $1 million there so we could all take a deep breath and figure out a way in the near future to help with that population. Whether if it's too late to test, I like an idea that you would put out as far as vaccines for certain areas. I'd like to talk about that later on down the line. But I'm not here, Mr. Chairman, to say we have to go to RFP. Again, I was never for that. All I'm for is for a plan that helps us to help ag. And this is what I'm going to close with, Mr. Chairman. When a couple months ago, I sent a letter out to the governor, and I have this letter here on my phone. I sent you a copy before I even mailed it to the governor. And I want to read you these two sentences so I could attempt to make a point here. When I drafted this letter, I sent it out to a lot of my ag friends, and I sent it out to a lot of Hispanic leaders to get comments on it. I sat on this letter for 2 weeks before I mailed it to the governor. My ag friends that read the letter and gave me their feedback, they questioned me on these two sentences in the letter, Mr. Chair. I'm gonna read these two sentences. It'll be three, but it says to the governor, the responsibility to ensure farm worker safety falls on all of us who hold decision-making positions. And here's where they had the problem. Let us not test cattle with more concern than the pivotal workers who take care of them. Let us not handle the wine grapes with more care than those who are picking the grapes. So my farmer friend said, Richard, why would you even say that? And they asked me to remove those two sentences, and I thought about it, and I kept going back and forth. I ultimately left those two sentences in the letter to the governor. But some of my farmer friends said, hey, we're taking care of our farm workers. We're doing everything that we can here with them. And the letter never said that nobody wasn't. My letter, if you read it, was 99% in support of ag and how agriculture in Kings County in the state of California is the greatest thing ever. If you don't believe me, go read my letter. I'll ask the clerk to make copies of it for you. But that was the thrust of the letter. And now today, personally as a Hispanic and as an elected official, when my own opinion is that we have not been as compassionate to that population as we could have been, as we should have been, and it's not an insult to anyone up here on the board, I'm saying it's my opinion. I believe we could have done better and we should have done better and we can still do better. And that's why I'm here today, Mr. Chair, because I want us to do better. And again, it was all based on, the letter is based on the economy, which for Kings County, we know means farming. Some of you know better than me because your fathers did it and you grew up doing it, and God bless you and them for it. I'm gonna close with this, Mr. Chair. They say that our nation is the greatest country in the history of the world, the greatest country in the history of the world. And we got there because of two simple fundamentals. One, that as Americans, we've always believed that the present doesn't have to be as good as the future, that the future could always be better than the present. And two, each and every one of us have a moral responsibility to ensure that that happens. And so going back to the letter, to make that happen, to continue to be great, the letter wasn't about saving farm workers. The letter was about saving our economy in Kings County, which is saving agriculture, which includes farm workers. And if we do that, it's about saving Kings County. We save our county, it helps to save the state of California. We help to save the state of California, then we help to save the United States of America. And that's why I'm here today in person to tell you that's all that I want to do. And so I appreciate your time. I'll back up and I'll look forward to the discussion on how we could just move forward. Thank you,
Thank
Mr.
you very
Chair.
much. So I'm going to go back to your question about where we go from here. I know I've been working with Ed Hill on this, and he's been working with Darcy Pickens. So when we started talking about the mobile testing, it was about bringing people in that we get tested or get out to them. And I made a comment that, maybe we should have some kind of food with it to draw people in. And I used the terminology like a barbecue that Gar Bennett does every year. They have about probably 5 to 6 of these, 5 to 10 of these in the fall season after harvest or during the end of harvest. And so I reached out to him. I talked to Tyler Bennett, and he liked the idea I pitched it to him, and he was all in. He sent me over to the marketing agent, Stacy DACII, and I talked to her for a little while, and she sent me over to Greg Mousson, which is the owner of Gar Bennett. And he said, whatever we want to do is fine with him. They're going to bring in, my job depends on ag people. They can do up to 1,000 people in a 2-hour period at these lunches. And worked out with Ed, we may have to bring in a second hour testing facility, and we can test at the same time. And I said I didn't want to shoot everything off at one time. I wanted to stretch it out over a period from here now until the end of December. Do 3 or 4 of these events throughout the community. And so right now, Stacy DACII has a week off. She's putting together the format for the language going to go on Hispanic radio and public radio and KMJ, and maybe some media stuff to draw people into these events. So we're there right now. We're moving forward. We just need to be able to have these numbers high enough to the next couple of days so that we can show that we can utilize this facility until the end of December. So right now we're trying to get things in the works to get this done. I think we have a capability of doing, like you said, she told me that we need to be prepared to do 1,000 people in 2 hours, testing and lunch. And they're going to get a hat, a free meal if they get tested, and 10% discount in the stores. And we have our Armona site set aside for it, and we have Lemoore site. We have electronic billboard to advertise it, and they're going to use, it's going to be their event. We're just going to have our testing facility there at it to test people as they get lunch. So we are working forward to it. It's just that we don't have a time and date yet to start advertising.
Is this something that the board decided on last week?
No, I was gonna announce the date during board member comments.
Oh, okay.
I worked on it from Wednesday till Friday night.
This is an event, is it working with ag partners? You're saying that this would draw, you believe that this would draw some of those
My job
workers?
depends on ag. They'll bring in, all the large ranches will bring in their staff to come and have lunch and get tested during these events.
That's something right there that I know I would be supportive of, Mr. Chair, because when you say that, it reminds me this isn't about pitting farmers against farm workers. That's nonsense, because we know, all of us know that during the drought, when we went 2 or 3 occasions to Sacramento for those rallies with Governor Schwarzenegger on the steps, those were working days. And the farm workers missed the working day and jumped on the buses. I know, because I rode with them. And we left here at 5 a.m. from our parking lot, and we got there for a 10 a.m. rally. And on the steps of the Capitol building, it was farmers, it was elected officials, community leaders, but the majority on them steps was farm workers. And you go back and you look at the pictures, and it's farm workers who were there. So those are organized events. If we go along that path, clearly, I believe you'll produce 1,000 people to get tested. And I would like, I think we can possibly add to that idea too, to build on something like that moving forward. And that's a refreshing idea to reach that population.
Yeah, no, and Gar Bennett enjoys giving back to the community, and they like doing these events. They can't this year because of COVID.
Mm-hmm.
They can if we make it a testing site. So they give back to their customers, their clientele, and show respect back to them. And through the county being part of their event, we can, use them and get our numbers up. I think Ed Hill talked about just a while ago that they readjusted our numbers down instead of up for the first time in a week, hopefully because of these tests here. And we're a 7.5 or 7.2, you said. And so we're on our way to be able to go down to the next stage and open up our businesses. So I think we're on the right track. It's a slow start. I know there was a concern about the National Guard. When they leave and we take over, it won't be the National Guard. We'll be able to move this thing where we want it without any restrictions, and get as many tests. We might do 2 or 3 sites a day. I don't know.
And on that end there, when the National Guard leaves, that's why I'm asking that we don't reallocate the $1 million in CARES funding that we've already have set aside, because I think there's room to, even if it's our county health department doing mobile testing, you have some of that money to pair up still with the good laboratory. Has been pointed out, that's part of the other problem. You got to have a good lab. And so with couriers running that to get a 24-hour turnaround on that. And so those are some things that I hope we can discuss, we can discuss, but this is work that you've been doing on your own since last week. And that's something I'd certainly like to be helpful with, and even helpful with, doing that out near Avenel, if we're doing it to test farm workers.
No, not a problem. It's just bring everybody together. When you ask someone to help work for you, it's hard to, they have the staff, and when the season draws down, they have more staff. We'll have to provide some staff too, but I think the $1 million is good to have in our back pocket. This virus has not gone away. We have not gained any ground on it other than testing and separating. So we need to keep that available to us. If we have an outbreak, we need to hit it harder. So.
Mr. Chair, could I ask Mr. Hill a question?
Sure.
Mr. Hill, Richard Valley, the future, I think you've touched on this, but now that we're getting closer, do you think that it is technically feasible to have an event where you're doing the COVID testing and giving the flu shot to that same person? Or has anything been identified through you and your health colleagues that that's not healthy to do, or someone's not going to like that idea? Is that a future model that you see could be happening in Kings County?
Supervisor Valley, through the chair, that's correct. The only subtle nuances that will be different in that process is, in the past, before you could get a flu shot, one of the disqualifying criteria is if you had symptoms. Back then it was, if somebody said, I have allergies, they would have been given the flu shot. That won't be the case moving forward, since the allergy symptoms, as we know and as we found from our experience with COVID-19, often is a mask of the COVID virus. So we're going to tighten up some of those items, but yes, it's very reasonable to believe that we would be doing immunizations as well as flu shots. And then while I have the opportunity, I want to make sure that I provide clarification on the data that you requested earlier, or level set. As Supervisor Verboen had mentioned, one of the biggest issues we've encountered with testing using this resource is the men and women in uniform and the fear that is associated with that process. When that resource leaves, and just so that everybody understands the data, we want to be as minimally as intrusive into these individuals' lives as possible so that we don't increase or foster any additional fear. For that reason, occupation is not a question that we ask. So I'm not going to be able to give you an definite answer on farm worker versus somebody that's a mechanic at an auto dealership. Again, that's why the main purpose and the main drive is to get the resource in those areas so that we have a better chance of testing more individuals in agriculture, livestock.
So, yeah, okay, so if I'm hearing you right, you're saying for us to ensure that we are testing farm workers, we need to go directly to them, which I believe that was the point early on was going directly to them. But then there were some problems ID'd with going to the workplaces scheduling. And so I trust that in the future we could work out all those logistics, and especially with an event like this, if we're going out to a farming area and having a luncheon, I think with our own eyes, we can walk away being able to say that we tested 1,000 farm workers today.
That's correct. I would feel more confident in the right areas than given those events.
Okay, thank you, Mr. Chair. Thank you, Mr. Chair.
And we got a lot of discussion about this event coming up. And like I said, we'd like to do 3 or 4 and space them out to the community and not try to do it all at one time. Because we may be doing this for some time and not to wear ourselves out. And if our numbers are going down and we keep getting a lot of negative numbers, we'll do it till we get the vaccine or it disappears. Okay, we'll move on now to administrative.
Mr. Chair.
Yeah, I think I was going to ask what you were about to ask. Are you prepared at this time, Mr. Chair, to accept a motion to just dismiss the RFP? Let's close it out.
Don't we have it on 30 days for now?
It expires on the 27th. So this is the board's last opportunity to weigh in on whether they would like to close out the RFP without an award or ask the RFP submitters whether they would like to extend it another 30 days for the board to continue to consider it.
What's the board's direction?
Mr. Chairman?
Yes, sir.
Ed Hill, Public Health. While the board has complete discretion, I would just like to throw out caution that if for some reason we can't keep the numbers up and that this resource is not a definite, we may lose it. So again, this is all predicated on the idea of keeping the resource busy to keep it here. So I just want that to be weighed in the consideration on extending or whether terminating the RFP.
So your advice would probably be to keep it another 30 days, see how this folds out with the free testing. If we're able to keep it, then we're in good shape. If we're not, we have to go to RFP to continue our testing.
That would be an appropriate course of action, given that the RFP work has already been done and the scorings have been done.
Okay.
Mr. Chair, I do have a question. As discussed, some of the limitations are the labs. And without seeing the RFP, is there a way, if we're going to ask for another 30-day extension, to carve out the lab portion? If we could just use the lab portion and not the testing portion?
We can't ask them to revise their bids unless we want to reopen the RFP for others. However, if the board considers the RFP going forward and you want to consider an award, you can negotiate that. In other words, if you select an RFP submission, you can then negotiate additional terms because the contract isn't done until the board says it's done.
Yeah, so kind of open up that line of discussion if we want to go ahead and let that RFP die, but go ahead and issue a new RFP for testing with the lab services carved out and have it as two different possibilities. And I'm kind of looking at you for that, because I think if we can get these projects going the way Supervisor Raboon has outlined, I don't think testing is going to be the problem. I think the lab results are going to be the bottleneck. And so, any discussion in that arena, Mr. Hill?
It's Supervisor Neves through the chair. It would be reasonable and relatively, well, I won't say simple because it's a contract, for us to start a contract process for a per sample fee with existing labs. I think that's what you were trying to get at. Please let me know if I'm wrong, so that we have something in place that public health has the lab capacity in case we need to expand services, as Chairman Verboen has mentioned, or in case we have to do testing on our own. Is that your question?
Correct. And do you think there's capacity in the system, or did we need to RFP or just go to a per testing fee?
I'm not sure that we would need to go out to RFP. I'd have to do the research for lab services. There are only a couple established labs within the county and within the valley. One is Quest and the other one is LabCorp. We would have to do a little bit more research, but then again, I think it would be easy to establish a per sample fee versus a long-term or larger contract.
With that, Mr. Chair, then I think, if we can, I would suggest we just extend that RFP for another 30 days and then do a little bit more research on the lab capacity and see if there's any reason to go through an RFP process for that lab, or just establish a cost per test. With that, I conclude my remarks. Thank you.
Is that a motion?
No, I think there's still discussion.
Discussion, please. Yeah, I don't have a problem with this. I just think, we might be kidding ourselves to think that we're going to place ourselves in a better position by contracting. I think that the labs are so overwhelmed, and that's just part of the research, I think, of figuring out. At this point, we have, a free testing site that's not costing anybody anything. And I would just like to make sure that we guarantee that if we're going to pay for something, that it's going to provide some sort of return, as opposed to, being in the same scenario now, just having to pay for the test instead of using the free test app or the test opportunity and getting the same timeline return.
Yeah, no, and I agree with that, but like Adventist Health, I think the lab is in Selma. I think United Healthcare System, I'm not sure what lab they use. We only have 2 in Kings County, but there are labs in adjoining counties that I think we could either enter into a contractual agreement or have an RFP process, whichever one, pending additional research, try to figure out what's the best option to go to. Because again, I think there was a time when the reactants were not available. I think that has somewhat resolved itself, but I think we can overwhelm the lab system very fast with testing, because testing is a 5-second procedure. The lab test is what they do.
Unless you drop it on the ground, you got to do it twice.
Yeah, and start all over.
Yeah.
Mr. Chair?
Mr. Chairman?
Yes, sir.
Also, I would just like to remind the board that last week we brought our epidemiological lab capacity grant to your board, in which we outlined the purchase of the systems and the equipment necessary to run these samples ourselves. If you recall, I was not very optimistic on how fast those would be up and running, but I do still want to provide that reminder. Yeah, I think I said about 4 months if everything went smoothly, that we do have that process in the work as well.
And do we have did you get a time when that machine was going to be delivered? Because I thought we asked for that even before the COVID stuff. And then everything got overwhelmed with COVID. And you have an idea when that machine might be able to be delivered?
Supervisor Neves, through the chair, you're correct. We did work on purchasing one before COVID started. It was placed on back order because those machines were being distributed to the high impacted areas of New York, Washington, and other areas. Through the ELC CARES funds, we're asking for another one, but I don't have an update. We are asking for an update from the vendor, but we haven't received one.
Yeah, and they're impacted like everybody else, and, you know, and it almost takes 200 days for a bus and 365 days for a fire truck. So I don't know how long it'll take for a lab machine.
Buzz Riley?
Yes, Mr. Chair, I believe the answer Mr. Hill gave last week to your question, Soup, was at the area of 4 months for that. It was a delay of 4 months to get that machine there, at least to the questions that I asked him last week on that topic. But I liked when you started off, when Soup Nev started off through the chair about possibly closing out the RFP to put forward a new one. And to get there, I wanted to ask, I know you guys probably know the answer to this, but Mr. Hill, the flu testing, is that free? Is that Fed or state money that comes to us to do the flu testing? Or are you going to be looking for funds to provide the flu vaccine, the flu vaccine, the shots?
Supervisor Valley, through the chair, we get an allotment every year of flu vaccine that we administer free of charge. However, the county has a established fee of $8 per administration. We will be bringing an item either next week or the week after that asking for you to waive that, which we have done every year in the past, so that we can provide that service for free as well.
Okay, thank you. And as the board is just having this general discussion on possibly going to a new RFP, if whether that's today or next week, doesn't matter. Is there anything where you would see an RFP request? One, as it relates to the labs and everyone's concerns about the labs, and everyone's right in that, and making sure the lab can show a 24-hour turnaround, that they have their own couriers at our sites to run them samples back to their labs immediately, to show that they have these agents available that's necessary to do the test. But do you see any way we could team up through an RFP, the flu shot given and the COVID test at the same time? Or are those two separate things?
Supervisor Valley, through the chair, was that a question for me?
Yes, sir.
I apologize. The flu shot, I would struggle with getting an RFP to provide that because, again, we provide that for free, and we would continue to do that service, as well as many of the pharmacies and other health clinics provide those flu shots as well for free. Immunizations may be a different story because we do charge, but we also have a sliding fee scale, so it's kind of misunderstood that we charge, because if the individual has no income, we don't charge, and that's why a lot of those individuals seek those services through us. So to answer your question, an RFP for testing would and for lab services would be more appropriate than the other services because we provide those free of charge already.
Okay, then, Mr. Chair.
Mr. Valley, Supervisor Valley, if I could answer your question from a legal standpoint, while Mr. Hill seemed to respond from a policy standpoint, there would be nothing legal that would prohibit you from issuing an RFP for both.
Okay, thank you. Thank you, Council. And I know, C. Peterson, I know your concerns are fiscal, and I'm with you. I'm not trying to waste $1 million for no reason. And if there's a free way to do it, then try it. But it's been tried and it's been going for a couple of weeks. I don't know where we're all at on the success of reaching that population that we need to be, but I would be for closing out what we have right now. I think we've all had a good discussion, and we don't have to direct staff to issue out a new RFP today. But we could take the week to prepare to come back next week to issue out a new RFP, a new improved for the mission, a tailored one that helps us with the concerns that we've all identified through this discussion today. So go ahead. You have a question?
No, I don't have a question. I think just to address a couple issues, from the population that, we're talking about wanting to test, the industry, from employer to employee representatives to associations are hard at work trying to create a schedule that have created a schedule, for this mobile testing site. It's no different than, the whole process that we went through of, well, only this thing can open, only that thing can open. Here's the state's, opportunity to provide input, to provide, opportunity for testing, further testing, and I think, this is no different, the free testing site that we've been provided has some limitations, and I know that the industry is working through it and become comfortable that, once the National Guard asset is no longer there, that's the first stop these testing facilities are going to. They're going to the fields. The schedule is already being worked out, and but they just needed that, that assurance that relationship between farm worker and employer isn't damaged in any way, and I think they've found a way to get through that, and that's just the massage and bob and weave that we've gone through to get to where we're at today, and so whatever you guys want to try with the testing, I still have a concern that you can pay somebody a bunch of money to say, okay, yeah, we'll test you for you, but you're still maybe going to be in that same line, and you're going to pay for a test or a lab result that was going to be provided free in the same amount of time, and knowing from one day to the next, what is one day cut short, cost? Maybe, some could argue maybe a life. I don't know, but I think, 2 days versus 1 day, those are all questions that I would ask of whoever's gonna, provide some sort of opportunity. And then what is the cost? We have this free asset. There's another one coming that will backfill this one that, the federal, well, I guess the federal asset we found out isn't coming, but it's a tough population to get. We're going to go into the fields. How many people are going to be tested? I don't know. That's at that point, it's their choice.
Yes.
It's their choice now.
Yes.
And so, whether it's successful or not, I think we'll find out, but it will be for an opportunity will be provided to every member, through, and has been provided to every member in the community. And it's just targeting those hard to get places that take some massage. And I know that, the industry has been working hard and meeting regularly and trying to create that opportunity. And so.
Well, I appreciate that. That's news to me that you're saying once the National Guard asset leaves, that our county health department is set to go into the fields?
That asset is set to go into the fields.
Okay.
We get to keep the numbers up the first 2 weeks. We get it till December 31st. But if you look at, you talk about, getting the farm workers to test. So we have 5 board members here. Out of us 5 board members, how many have been tested?
You.
It's me. So you can't force anybody to get tested. So it's, you gotta want to do it. So we just gotta get the information out there that it's safe to do, it's easy to do, and it's good to do. Not that you have to. So that's the key right there, I think, is I can't force Craig to go out there and get tested.
Oh, yeah, no, but the point of view has always been based on the public health director of Ed Hill putting us on notice that here is where our problem is in Kings County, and we have to do something about it. And to do something about it, we haven't met that yet with the plan. We tried the free, but when you went for the free, and I don't blame you, like I said, fiscally, hey, give it a try. But at the day that you voted to go with the free, the public health director either didn't know or didn't tell us that it was National Guard. Whether or not that is really a problem, I guess that remains to be seen. But the only test that we have is not my opinion. It was the opinion of 5 Avenal City Council members who talked to their community and gave feedback to the public health director. So that's the only thing we have. I wouldn't be in favor of sending them out to the
Out of those
fields.
5, how many have been tested?
Out of the 5 of who?
The
But-
city council members.
But I don't see where that, I don't see where that's the point.
No one really has a choice of what should or shouldn't be done if they haven't done it themselves.
But the only, again, it's not the personal choice. It's going off the public health director saying, here's where the issue is at in Kings County. And either we do something about it or he does, because early on, I would always tell Mr. Hill that I believe going into this pandemic, when he looked around the other states, not the states, states, but I was doing a lot of reading, as we all were, on the state of California. Public health directors weren't sitting around waiting for their board of supervisors to tell them how to do their job in the middle of a worldwide pandemic. Public health directors were going off their professionalism, their education, and their obligation to keep the residents of their county safe. And they were moving forward. In some cases, some of the boards, like in Orange County, they would fight back with their public health director. Public health director would say, this is what we need to do, politics to the side or not. Board of Supervisors would vote and override the health director as we could. But then you've seen those health directors resign and say, you're not allowing me to do my job to keep the community safe, because politics got in the way. So I always told Ed, or going back to March, you should be the face of this, Mr. Hill. Media requests are going to come. The news is going to want to interview us. The supervisors shouldn't be the one on the news, because then it's going to be political. It should be you. And by you as a health director talking to the residents of Kings County, it removes politics and people might listen to you more because they see you as that health professional. So I would have no problem with Mr. Hill telling all of us to go jump off a cliff. I'm here to do a job. You're not allowing me to, I've told the Board of Supervisors, here's where your problem is. It's an essential ag workers, farm workers, and dairymen. I'm going to go test them, and I'm going to do it my way. Now, we could override them, but at least it's on the record. But I would be all for him taking that direction, because I believe it's his duty. He's the professional in there, not us, him. And I believe he should call it and do his plan and go solve the issue that he's told us. Because now that it's up to us, we've squabbled. We've had some arguments. We had disagreements. But look where we're at today, a month later. No action, no plan. And to table it again today just delays it another week. The only bright hope is the chairman is put together an event that I'm all for helping and being supportive of. But other than that, we don't have a plan here.
So I'm gonna step in a little bit. So early on, we had some major outbreaks that happened at a packing shed near my residence. And Ed jumped in and handled it within minutes. I mean, he didn't use me. The phone call was made to me to get some contacts made, but once I made the contacts, Ed took it over and the problem never exploded. So, I mean, I commend Ed for the job and his staff did for the packing shed near my house. I worked with him on Quelo Meats. I mean, we had a lot of resistance from the owner of Quelo Meats not wanting Ed to come in there and take over. Ed was in there trying to do his job, but it took a phone call to calm the owner down to allow to understand exactly what our end project would be. And I think it worked out well. I mean, we had about 10 days that were a little tough, but we got through it. And I commend Ed on his staff for doing that. So I think Ed has done what he could do. It's just, we live in a community that sometimes the people don't want to listen to our health director. They want to talk to us first.
Yeah.
So we still need to be part of it. So Supervisor Peterson.
Yeah, I mean, with your comments, I think you're painting with a little bit of a broad brush, with respect to, the testing. I mean, and how the health director has went about it, because I know the biggest outbreak we've had in this county, or one of the biggest, is at Avenel Prison. And I know he was in there fighting, and it's almost insulting that, the biggest pushback we had from anyone in this county was a state agency. a state-run agency that is
I agree with you.
mandated, this is how, it should be. And so, I look at that, I look at, and none of us always have all the information, but, I can tell you that the industry in Kings County has come together. And, for me, I assisted in some initial discussions about this, and then I just stepped back and I said, okay, roll. Here's a free opportunity. Here's a free testing opportunity. I don't need to be involved in this. I don't need to be out front of this. Let's massage it and get it to work. And I think that process is working. It's not immediate, but it's not the fault of anyone in this county that the foresight or the lack of vision that the state would send a National Guard staffed, full well knowing, and the state has taken the position all along, we're not going to enforce, the immigration issues. Well, these are National Guard, folks controlled by the state. They're not going to enforce, that. But the perception is that I've shared that with HHS director. I said, here we are. You sent an asset here that we've spent, a day trying to. We had some good response, and then we find out that they're, in dressed the way they are. I'm glad we have National Guard, but it's a process in formulating how you get through these issues, and I think we have the health director has pushed, and with respect to those health directors that have resigned, I would speak with a pretty strong feeling that a lot of people never imagined the amount of pressure that they were going to be under in that position, and I don't think it was a lack of board pressure. It probably was in some positions, but there's a lot being asked of these folks right now, and I think that is as big an issue for departures of health directors as maybe pressure from some outside influence.
And
Ed
having
has
your,
his hand up right now, so.
oh, who does?
Ed Hill.
Oh.
Ed, you got your hand up?
Yeah, thank you, Mr. Chairman. Just wanted to drive home a couple points here, and that is Supervisor Valley is correct that, I did point out that there are our highest numbers right now are in the agriculture and livestock community, and that we want testing in that area, and that's what we started to drive for. And I continue down that path, and we do have a plan, and it's to use this federal free resource for a couple of reasons. One, it was up and running already. It wasn't a system that had to be established. Now, yes, there were hiccups with it, and the information did not come in all at once, and it was trickled in. And as I had mentioned before in the past, and I still mention today, this information changes on an hourly basis. Same with the National Guard resource that was being deployed. Just like with the OptumServe web or testing site we have now, we were given 2 days notice to deploy these items. So that is not optimal, but again, the whole goal is to get this mobile testing resource out into the rural areas where the agriculture and livestock individuals live and work and recreate. But not only that, it also had the most opportunity for sustainability. As I had mentioned in my other reports, the $1 million is only going to buy about 6,000 tests, regardless of which vendor you choose, including our own department, Kings County Public Health. This free resource is the most sustainable one because it has the opportunity, or we have the opportunity, if we can be successful and keep it here, of it staying through December, which then would give us the ability to test up to 50,000. So from a public health perspective, my plan has always been to get the resource out in the agriculture community, but then two, to do it in the most efficient and cost-effective way, as well as maintaining some type of sustainability. As mentioned in the past, this is not going to go away anytime soon, and I think we're going to need a resource even past December, but this was the most sustainable one at the time.
Okay, Mr. Chair, if I might. So Mr. Hill, I get all that. So two things though. If it's just a perception on the National Guard issue, and by the way, early on, you told me that the National Guard was, that this was being used in Kern County successfully. So I texted a friend of mine who's on the Kern County Board of Supervisors, and I said, is the National Guard doing mobile testing in Kern County? And the reply was, hell no. But they have been. I mean, you pointed that out. But maybe some people, those board members weren't told it's National Guard. Maybe, they're not paying as attention as we are. But I know it's National Guard. We know it's National Guard. It surprises me that this supervisor didn't, because this supervisor is extremely intelligent. But it just plays into a whole lot of other questions I have down the agenda. That being said, though, it just kind of feels like you still want to take a square peg and fit it in the round hole. And I'm not trying to insult you there. I want you to be successful in the problem area that you have identified. And I've been trying to help you be successful in the problem area that you've identified. And your efforts have been there. I mean, even 2 weeks ago on the Avenal City Council meeting, you might recall that when I opened up, I told the Avenal City Council that nobody has worked harder during this pandemic, including myself, than Mr. Ed Hill right here. You recall that I said that, and I told those council members that. That being said, if we haven't figured out how to mitigate this problem that you've publicly identified, do you feel it's your responsibility or the responsibility of the Board of Supervisors?
Supervisor Valley, through the chair, I'm not sure I fully understand your question. Can you restate it, please?
Okay, I'll try to make it simple. Whose responsibility is it? You have publicly put us on notice as the 5 county leaders that we have an outbreak in a certain population of the county. To date, that problem still exists. Is that the fault of the Board of Supervisors or your fault? Meaning, whose responsibility is it to solve that issue that you identified?
Supervisor Valley, through the chair, it's going to take everyone. Whose responsibility is it? It is the public health's responsibility. It's the county's responsibility. We are trying to get that resource out to the areas where it needs to be. And as you have identified, the City Council of Avenal did not want it out there, which was disappointing, but given that that's one of the main areas where we need to get that resource. But it is the responsibility of everyone in the community, including myself, to get that resource to the areas that it needs to be.
Okay, but just to refine it, and I'm gonna let you go here. It's not everyone is getting paid by the taxpayers of the County of Kings for the job that you do. You're the only person in the county that has your job title. So that's where my question is to. Do you want to answer it one more time? It's to you as being the Kings County Public Health Director and the Board of Supervisors. Whose job is it to mitigate the problem that you have publicly identified of where the outbreak still exists in the County of Kings? Is it us or yours directly? One or the two?
It is my responsibility.
Okay, thank you, Mr. Hill.
Okay, any more questions or comments? We're going to have a motion to do what with RFP?
I think we'll ask for a 30-day extension.
Okay.
Direct Director Hill to expand or at least do some research on lab capabilities and bring it back in 30 days or 28 days.
That's the motion by Supervisor Neves, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Mr. Chair.
Could I have some clarification as well on the motion? So this is to reauthorize the current
request
RFP
because the vendors do not have to approve it. So I think my motion was to request a 30-day or 28-day extension, not knowing if the vendors are going to accept that 28-day cycle.
That was exactly what I was going to say, that we can request that they keep their bids open for 28 days.
Starting
but
today, Sue, Nevs?
Except that they can decline as well.
And that was part of the motion. The motion was to request a 28-day extension, but not, we can't force them to keep those options open.
And again, are we asking for more though? Are we asking for
No.
we're not asking for the lab opportunity?
No.
They were requested in the original RFP to give us a bid on testing plus lab. I answered Supervisor Nev's question earlier that we cannot now go back and ask them to revise their submissions to separate testing from labs. However, if 28 days or so, within the next 28 days, if they were to extend their submissions and the board were to choose to award a contract based on the RFP, we could then negotiate with the award recipient to separate testing from lab if we wanted to. The alternative, of course, is as we discussed earlier, which is terminate the RFP, issue new urgent emergency RFP with very quick turnaround that would then separate testing from lab work. But the motion currently is ask the bidders to extend for 28 days their current bids as submitted and direct the Director of Public Health to do additional research regarding contracting opportunities with lab services only. Is that accurate, Mr.?
Correct. Either a contract or establish a fee per test.
Well, my question though is, doesn't that require us to open up a new RFP if now you're asking for just lab only?
Yeah, not if Mr. Hill can find out that there's sufficient capacity in the system and find out and separate out the lab test.
And the other alternative would be, as discussed earlier, if Mr. Hill finds that there's virtually only one provider that could offer what we would be asking for, it might also qualify for a sole source contract. That's what the additional research would reveal, would be whether it would qualify for sole source or would have to be bid.
After an RFP is killed or still open?
It is not recommended that you issue a new RFP until the current RFP is closed, either with an award or without an award, because you would be duplicating services.
Got it. And then it would open up, per the health director's opinion, like he said, there's only one qualified applicant who could possibly do it, then you could sole source.
That is correct.
And I don't think that's going to be the case because I think there are multiple labs. So I don't think it's going to qualify for the sole source.
It is conceivable, and I would agree with you regarding likelihood, but depending on the actual request for service, such as if the board were to include a standard for available testing reagents, and there was only one that could meet that standard, then hypothetically it could qualify for a sole source.
So go ahead. I guess that kind of muddies this for me a little bit then, because if you have the current RFP and only one provider can provide the redefined purpose within it of testing, then it's really not, I mean, there's obviously, as stated, there's multiple companies that do testing or do lab testing, but maybe within the 5 or whoever responded to this RFP, there's only one, then that kind of presents a challenge for them. And it presents a challenge to the county in that, the negotiated value only dealing with one company becomes not very competitive possibly.
Supervisor Peterson, it would be under the public contract code, not advised can't say it would be illegal, but not advised to impose new standards on the negotiation, given the current submissions. We would have to negotiate with the provider based on the current submission. What I was suggesting was that in those negotiations, we could say, for instance, we asked you to submit a bid for testing and lab. We'd like to talk with you. We'd like to negotiate with you to, for instance, hypothetically, exclude the laboratory work. What would be your deal with respect to testing only? And then consider potentially RFPing just for testing, but we would not be bringing in any new standards that were not included in the original RFP to govern the current submissions.
Can I add to that too, Mr. Chairman? Theoretically, I would assume that the everyone who responded to the RFP, because that was a game plan and the challenges that were outlined was that we need lab, we need courier, we need them to be able to provide the test, show proof they had the agents. I would assume anyone who applied for the RFP on paper is saying we could do that. Realistically, maybe it's time to hit the reset button to find out if they really could do it, right? And so I don't want to talk about another motion because I don't like when it happens to me. I want to respect the motion that's on the table, but I would wish that I would just put into the, before we vote, that the public health director's is concern is that if we lose the free federal testing and they're gone, that he's saying, hey, maybe we should leave this RFP open because we might need somebody. But if we are willing to wait another 28 days, why wouldn't we clean up this whole conversation, kill the RFP, and direct staff to put out a new one today and put it out for 72 hours or however we did the last time. And then the point that Ed has about losing time, that goes away because now we have a new one out, but we have a new one targeted for what we're all looking for, and it's more clean, and we put it out.
And Ed has his hand up right now.
Yeah.
Ed?
Thank you, Chairman Verboen. I just wanted to add clarification on a comment made by Supervisor Valley earlier about me having the ability to approve a sole source justification. That is not done by me. That's done by the purchasing manager and county council. So I wanted that clarified. I also want to point out the pitfalls of a fast turnaround time in the RFPs. As you know, we encountered that during this last process. It would be better if we do go out to RFP again, that we give the proposers the opportunity to build a good and cogent proposal to be submitted to the department.
He's right. What is that? 7 days, Mr. Hill? 10 days? 2 weeks? What? I know there was challenges.
I would refer to purchasing manager on that. It's my understanding, depending on the size of the work and the contract itself, kind of dictates the length that the RFP is open. But I'm sure we have a lot of, well, I shouldn't say that. We may have some flexibility there, but I defer to the purchasing manager and county council.
I would respond similar to when we discussed this, unfortunately, back in early August, late July, early August, about the issuance of the current RFP. It would take us 2 or 3 days, I would think, to retool based on the work we've already done on the current RFP to segregate out testing from lab services and come up with the kinds of standards that Supervisor Neves has suggested or any other standards that have been part of today's discussion. We could put it on a 72-hour turnaround based on the urgency associated with the pandemic and securing the services. It would take probably 5 days to 7 days to review them, depending on how many there are, rank them, and come to the board with a recommendation. Just as we suggested at the end of July, early August with the current RFP, if If the board felt it was urgent and we were in between meetings, the board could call a special meeting in order to award it. So conceivably, Supervisor, I would say a week to 2 weeks, if it were given the urgency that is suggested by the board's discussion.
No, thank you for that. I think Mr. Hill is right that we made mistakes as we were trying to do the right thing with a sense of urgency last time. We made mistakes. It's caused issues. So I'm not asking the question saying we need to be urgent. I'm saying if we went down that road, I'm all for taking the time, but just whatever that time is. But I think that's action versus just tabling it. And we're coming out of here again today without really any action on a problem area that's been identified again today. So again, with respect to the maker of the motion and that the fact there's a motion on the table, we can't even talk about that any further unless the maker of the motion wanted to change the motion, or we just went to see where the vote went.
I'm not going to change it. And
Okay.
my point is that the vendors have the opportunity to refuse it. And we might be there next week anyway.
Okay.
I think this is a way to preserve all of the work that the reviewing committee did and keep those bids open for another 28-day cycle. But that's all it is. And again, we might, when we request the vendors for a 28-day cycle, and if they all refuse us, well, then we know we're going to have to go in a different route.
Next week.
But
Probably,
yeah, but I think this is the most prudent way to go because we do have vendors in place. We do have standards in place. We have everything that should that federal resource leave, we can jump and be able to do that in a turn on a dime. Under your scenario, we would not be able to do that.
Yeah. For at least a month out, 30 days or so.
I think the motion covers all the bases.
Okay.
And I would also state that, from the standpoint of requesting proposals, if we were to request, I mean, it just, for me, and being from the business world and, your word is your bond and you go out and you request a bid from someone full well knowing that, there's probably a pretty good percentage guarantee that this asset is going to stay here. And then you're asking people to go out and I mean, I get this is a different scenario, an emergency scenario, but it does cost, a company to provide a bid and all of the review that would happen at the county. So, I think we need to be pretty, at least from my point, pretty sure that this is an asset that we want to go out and ask for and not, now maybe twice go out to companies and say, hey, shoot us a bid and we don't use any of those bids again. And so I think this allows us some time to get to where we need to be.
Super, I might. But I think we're doing that because Ed Hill is saying that at some point we're going to lose the federal asset. And if he ends up doing the testing himself, he still needs a lab. And so maybe, if we are going to wait, then maybe if we do issue out an RFP, it's not knowing that we're going to spend $1 million. Maybe we're going to spend 500,000 because, we have the ability to test internally and now we just need lab services.
I'm just saying from an assurance that, you're giving a company, an option. Right?
Yeah.
I mean, a pretty good sense that this is something that we're going to use and please bid on it. So
I'm with you on that. I think some of the vendors are not very happy with this whole process, but I'll leave that right there too. I agree with you 100% on that point.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, 5 in favor. We're very enthusiastic. I like that. So we're going to go ahead and take a 5-minute recess and then we'll come back to administration. Thank you. We're back. It is 11:04, and we're going to move on with the California Public Finance Authority meeting. And this is Tuesday, September 22nd, 2020. And this is a regular meeting of the California Public Finance Authority. And Madam Clerk, please call the roll.
Joe Nevs,
Here.
Richard Valley,
Here.
Doug Verboon,
Here.
Craig Peterson,
Here.
Richard Fagundes.
Yes.
Okay, all 5 board members are present, and we're ready to conduct business today. And we're going to go to item number 2, approval of the minutes from September 15th, 2020 regular meeting.
So move.
Moved by Supervisor Fagundes, seconded by Supervisor Nevs. Madam Clerk, please call roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Aye.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
5 in favor. We will approve the minutes as presented. We're going to move on now to the consent calendar. All items on the consent calendar, one motion. We have one item.
Move is printed.
Moved by Supervisor Nevs, seconded by Supervisor Peterson. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Aye.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, 5 in favor, and we approve the consent calendar as presented. We're going to go on item number 4, new business. Consider approving resolution 20-05A for California Cross Point High School, City of Hayward, City of Alameda, up to $29 million in revenue bonds. And I think hopefully we have staff, Scott Carper on the line today.
Hi, actually Kate today for Scott. So I will give hi there. I'll give a quick overview of the project. So the California Cross Point High School is a school located in Hayward. They serve approximately 350 students in kindergarten through 12th grade. And they have requested CalPFA to issue up to $29 million to finance some improvements to their campus. So that will include finance or refinance the acquisition, construction, installment, improvement, furnishing, and equipping of educational facilities, including an existing 2-story building, also a new multi-story building that will contain classrooms and other instructional and administrative spaces, as well as student residence facilities. Also a new building for a multi-purpose assembly hall, and also related facilities, including landscaping and site improvements. I'll be located on a 5.5-acre site adjacent to the current campus. The city held a TEFRA on September 15th, and CalPFA held the TEFRA on Friday with the Board of Supervisors approving it this morning, I believe. Bonds will mature in no more than 35 years, and they will be issued in compliance with our issuance policies. And the school provides a number of benefits to the Hayward community. Again, they teach over 350 students. They employ 67 staff members, and they are looking to grow the school through this financing. Happy to answer any questions if you have any.
Thank you, Caitlin. Any questions or comments?
No. Approval.
Moved by Supervisor Fagundes, second by Supervisor Peterson. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Okay, 5 in favor. We've approved your resolution number 20-05A for Cross Point High School. Thank you very much. And we'll move on now. Public comments. Do we have anybody online that would like to speak?
No.
Any staff comments? Caitlin, you got anything you want to add?
No, nothing to add today. Thank you.
Okay, thank you. At this point, we'll close California Public Finance Authority meeting. Do you need to change anything before we go on back to the board meeting?
Okay.
Okay, we're back at the King County Board of Supervisors meeting, and we'll start off with item C, administration, Rebecca Campbell. Good morning, Rebecca.
Good morning, Mr. Chairman, members of the board. This next item came as a result of your board entering into a contract with JCR Entertainment for the IMAS campaign regarding communication on getting the word out on COVID-19. The campaign covered media on covering your face in addition to social distancing measures in place in Kings County to the community. Jose Ramirez, world champion boxer, held a fight on August 29th. And as a result of that fight, there were a couple of sponsors that sponsored that fight that asked how they could help. As part of that, Mr. Ramirez did a campaign to auction off his boxer shorts and his boots that he fought in during that fight. As a result of that, Wonderful Pistachios and Almonds, Central Valley, this is a facility located in Lost Hills, wanted to help with that promotion and asked to match the proceeds from that promotion. That promotion was held on September 4th on the Ray Appleton Show on KMJ Now, 580 AM, 105.9 FM. And those boxer shorts and trunks and boots were auctioned off. The proceeds made on that was $10,000, and Wonderful Pistachios matched the amount for a total of $20,000. Also, Trinity Packing Company was the local grower from Ridley that donated the $10,000 in the auction. So following that, there was another vendor, Hawaii Technologies USA, that also asked how they could help with the campaign, and they are donating 15,000 surgical masks to the county. Those masks will be provided to the agricultural department, and the ag commissioner will hand them out to agricultural workers and businesses. So I'm here today to ask your board to accept the donations, a total of $20,000, $10,000 from Wonderful Pistachios and Almond Central Valley, $10,000 from Trinity Packing Company, and also 15,000 surgical masks from Hawaii Technologies USA.
Okay, any questions or comments? I know that this is an extra $20,000 that we'll get into our hands to do with what we like to do with. And I had made a comment on the radio when we were on there a couple weeks ago that possibly we save this money and we use it towards when the vaccine comes out, get it to our workers that are at the outreach of our community, if that's at all possible, if we need to. The mask we should receive this week. I think I CC'd Catherine on it. She needs to call the person to talk about where we're going to get them. We're going to get them this week. We were going to store them in Supervisor Valley's office because he wasn't using it, but we'll probably take them over to the Ag Commissioner's department, let them handle it. And then we may just go ahead and use it when we do our outreach for the testing sites too. So there's a lot of things we can do with this stuff. And we appreciate Trinity Packing, and we appreciate Wonderful Pistachios for their efforts and donating back to us for our campaign. So any more comments?
Madam Chair?
Yes,
If logistically, if it's easy to store it, you have, by all means, put the mask in there. You're talking distribution. Yeah.
We have to get a forklift in here.
Yeah. Well, we'll see. But you can absolutely use it. I'm not going to be using that space a whole lot. Mr. Chairman, specifically on the Appleton show, your words were that the 20,000 for farm workers for vaccine. And I was listening, and I texted you immediately and said, that's a great idea. I was mad because I didn't think of it. And so I am very supportive of that. And if, so we accept the money and we table it, with that in mind. I like that. And looking for a motion, I would move to accept the donation. I think legally, that's all we can do today is just accept it, but with the good thought that you have in mind. And so when the time comes to put that back on agenda for the use of those funds.
We're going to give you a shot first.
What's that?
We're going to give you a vaccine shot first.
No, for sure. I'm going to get my flu shot and my COVID test at the same time. Oh, you're giving me a COVID shot?
Yeah. You need a guinea pig.
I assumed I got that when I sat down here. It was all over, sneezing and wiping the keyboard. But so if you're looking for that, Mr. Chair, leaving it open for further discussion, though, I'll put on a motion on the table that we accept the donation and that we absolutely thank Wonderful Pistachios, Trinity Packing, and Jose Ramirez for the efforts here. This is beautiful.
Thank you.
Supervisor Valley, just for clarification purposes, are you including in your motion the approval of the budget change?
Oh, yes. Okay. Yes, I'll add to the motion the approval of the budget change as well.
Yeah, and turning his office into a storage facility for the
Yeah, you could use it.
Do I have a second?
Second.
Supervisor Peterson, seconded. So Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Aye.
Craig Peterson,
Aye.
Richard Fagundes.
We have 5 in favor, and we appreciate all that wonderful and Trinity did and Jose Ramirez for doing that. So thank you very much. We'll move on now to item number 2. The county administrator makes no recommendations on this item here. Rebecca.
Yes, last week at the board meeting during board member announcements, Supervisor Valley asked that the performance evaluation of the Director of Public Health, Edward Hill, be put on the closed session agenda. The item is brought back to your board today. Historically, in the past, the county administrative officer has only put an item on closed session if there's an issue to be raised. And so I don't make a recommendation today, but I'm putting it on the agenda.
It's a revolution.
Putting it on the agenda for your input and vote. Someone
Can't
put
figure
that
it
on
out.
there?
Okay, so where do you guys want to go with this item here?
I didn't upgrade and I can't seem to figure out the new stuff. I'll be with you after.
Supervisor Valley?
Yes, thank you, Mr. Chair. Mr. Chair, as I mentioned, I was very much looking forward to coming back, and as always, do try to act like a gentleman up here. I think I even showed that today. That being said, there was just some things that need to be cleared up to move forward. And so I'm asking this respectfully. I do want to point out that this is actually a historic moment. It's the first time that a county supervisor has asked for something, and we got to play by the rules to get something on the agenda. I've sat here for years, and over the years, I've witnessed multiple board members on a whim make a request during board member announcements, and no one says anything. It gets put on the agenda. But anytime Supervisor Richard Valley asks to do something, all of a sudden there's rules. Okay, so last week I asked, which if any one of you gentlemen asked, I would respect it. There's a situation with the department head. Respectfully, I asked to bring it in closed session so we don't have a public discussion and air dirty laundry. I believe it lines up with the ethics of human resources that you don't just publicly put out somebody's dirty laundry. So I asked, I would like to have this in closed session. I have some concerns that I would like to share with the board regarding our public health director. I'm also being fair enough to say I would like him there so it could be a two-way conversation on it. But the CAO and the county council are quick to put rules on me for that. If you would have did that, Mr. Chair, it would have been no problem. It would be.
They like me.
It would, yeah. That I guess that's all it comes down to, because even today,
Correct the record.
even today,
Assuming we like you.
You don't like me?
I'm sorry, Supervisor Valley.
yeah, Mr. Chairman, even today during the unscheduled appearance, the superintendent of Reef Sunset calls in. He gets done. He makes his comment. You had a conversation with him. You started a conversation with him. So then I asked to be recognized. The minute I asked to be recognized, county council chimes in with the rule that only applies to Supervisor Richard Valley. She didn't tell you to watch how you approach the conversation and that it had to be in the form of a question. But for me, it's always a rule. And other department heads and other county employees notice it, and I get phone calls, and it's embarrassing. You know, I'm only doing this today because back in boot camp, I remember our drill instructor one of my drill instructors told me, do not mistake my kindness for a weakness. We've been there for 3 weeks already, supervised 24 hours a day. The first Sunday morning, 3 weeks into it, he came out and he said, I'm gonna leave you knuckleheads alone for 1 hour. Shine your shoes, pray, read the newspaper, iron your uniforms. I'm gonna be in my office. I'm gonna give you guys 1 hour. Do not mistake my kindness for a weakness. So, hey, it felt good. I can do whatever I wanted for an hour. in that boot camp barracks. But I'm going to say that today. Don't mistake my kindness for a weakness. I'm respectful. I respect the chain of command, but I also know where I stand. I stand in the same footing that these four gentlemen stand. We are elected. We sit here because of thousands of votes that we received to put us in these seats. There's two people up here that are sitting here on 3 votes. And I happen to be one of those 3 votes that they need to be sitting up here. And I'm not going to allow them to disrespect me or my district. And that's what's taken place. So I'm asking here, Mr. Chairman, for something very simple, for anything that you would ask for. I have an issue with a department head. I would like to be respectful of the situation and have that issue taken up in closed session. And I want to learn what this model is, because this is something I'm going to bring up about our CAO as well. Thank you, Mr. Chairman.
Okay. Any more discussion? Supervisor Riley, I'd like to bring up a closed session item, bringing up performance evaluation to Health Department Ed Hill. At that time, we can discuss anything that has to do with Ed Hill. Either we can, point him in the right direction or give him a pay raise, whatever we choose to do.
Yeah.
Do we have a?
And it doesn't mean that I want to terminate Mr. Hill. All it means is I want to have the conversation amongst my colleagues with him in a closed session. It does not mean that. And also, Mr. Chair, I'd like to point out, I just asked the 2 questions. The CAO, through the chairman, said that it's your duty to, that this was basically not something that was needed to be done because you as a CAO conduct the job performance evaluation. So I'm going to ask you, when was the last time you conducted a job performance evaluation of Mr. Ed Hill?
Historically, the job performance evaluations have been done. I'd have to go check, but I think they've been done one time at this county.
Okay, I'm asking, when have you, Rebecca Campbell?
I have not done one.
Okay. When is the last time that you, as a county CAO, has done a job performance evaluation on any department head?
I have not done one.
Okay. So why would you bring up that county policy the moment that a county supervisor asks to have a conversation with his colleagues on a job performance evaluation of a department head?
I was just bringing up historically how things have been done here.
Okay, and so historically, it sounds like that just does not happen. So I would ask that that part gets removed from the conversation, Mr. Chairman, and respectfully, that you give me what I would give any of you, was just the opportunity to sit down in a closed session to have a private discussion with one of our department heads. That is all that I'm asking for.
Do I have a second? I'll go ahead and second. Just
Can I
for,
ask a question? I was under the impression that this would be, you had some questions, not an evaluation.
I have questions. Zach.
Here, I'm grasping now that this is an evaluation. Is that under the same, that'd be under the same?
Only a performance evaluation would be allowed into closed session under the Brown Act. Questions would need to be asked either one-on-one offline or two-on-one offline, or in an open public session. If that's all it is questions.
It's under the umbrella of the evaluation that I believe you guys pointed out that part correctly. Because under a performance evaluation is a time to ask questions. So you call it whatever. I'm looking to do it.
always get a salary increase too.
Yeah, you walk out of there with a salary increase. Technically, that what I'm saying is I'm not looking to terminate. I'm looking to have a conversation to get some things online to move forward.
So my question is, I've had some issues in the health department area with this COVID-19. And I've always gone to Ed. Sometimes it takes them a day or so to get back to me. But I understand that he's very busy, as you stated earlier, that everything's running fast now for him. A lot of questions for him, a lot of answers, a lot of questions coming down from the governor that for me are stupid. Because they don't make sense. 1 hour is one way, 3 hours statement late from the governor is different.
Mhm.
And I understand where he's at, so I don't bother him, but he's always gotten back to me. So any issues that I have had, I've always gone to him and I've got an answer back. So, and I think any one of us individually, Doug says that he's done the same thing, you know, had questions, and I'm sure every one of us have had it. I've always got my answer, so I haven't got an issue with that at all, personally. And I don't understand some of the questions that we have. We can't get answers immediately. So that's where I'm at, and it's kind of an issue for me because I feel like I'm in the middle here.
Well, respectfully, all I will say is that it is way beyond that. If it was that, I've done that as well. Okay. But it is beyond that. And so, without going into detail in public is why I'm asking for the closed session. Now, if a elected official asked for this conversation and was denied, you're denying an elected official, you are silencing an elected official. That's what happens here. I'm going through a process that none of you have ever been subjected to. It only applies to me. If any of you, and I've seen it a bunch of times, it happens. You say something on a whim, boom, it gets agendized, it's on. That's all that should have happened last week. When I said as a county supervisor, under board member announcements, I waited for the appropriate time. When I asked, it should have just been, okay, we'll get it on the agenda. Now it's embarrassing for me to even have to have a conversation, to feel like I even have to lobby the 4 sitting county supervisors to go have a private conversation. It's embarrassing. It's insulting to me. But here I am having to do it, and I'm trying to do it with honor. So I'm asking you respectfully to give me the opportunity to have the conversation.
You got a motion, I seconded it. So any more discussion? Good. Madam Clerk, please call the roll.
Joe Nevs,
No.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
No.
Richard Fagundes.
Oh,
Okay, item dies 3-2.
Well, then for clarification, then we'll go to county council then. This is the part that I don't understand. So you are an appointed official, the CAO is appointed official. Those appointments take place in closed session. It's a vote for you to get those jobs. They take place in a closed session. So under this model here, where I'm being denied an opportunity to have a conversation with the department head, you're telling me that once a CAO is appointed, the CAO is there forever. If a board member can't get that conversation in closed session, is that what the public is supposed to be told out of this process today?
Supervisor Valley, I have to correct a premise of your statement. No action may be taken with respect, no final action may be taken with respect to a local agency executive defined as all the way down to managers and potentially supervisors, unless it is done in open session by the board. Under the Brown Act, you can have discussions regarding performance reviews. If one, the chair puts it on there as a matter of necessity, the CAO believes that it's in the board's interest to do so, or the board votes. Well, or the board as a matter of consensus agrees it should be on there. And if they can't agree as to consensus, then as a matter of majority vote, that's the process. Presumably, when 3 board members agree that a performance review needs to be done, it will be calendared and you will have that opportunity.
Okay, but so it just took place, for the record though, is an elected official, a process that a conversation that I'm trying to have about a health director in the middle of a pandemic in Kings County is being silenced because we had to go to a vote here today. That's what the public is going to take away from this.
I have no comment on your
That's what just
characterization.
Well, you're trying to take my vote away. I get to vote in this. Everybody here was elected by the people of the county. We all have different opinions and it shows all the time. So we all have a vote here.
Let me ask you this, because you're right, but do you think it's fair that I had to even go through this process to ask you to have a conversation with the
I think it
department head?
was clarified at the last meeting that if there was a consensus that it could go, there was not, so it was put on the agenda.
Mhm. But have you ever seen this take place since you've been here?
Yes.
You have?
Yep.
I have not. Mr. Chairman, I would ask you then, is the chairman, if you wouldn't mind, you and I having the conversation with Mr. Hill, set a time so I could at least have the conversation amongst you as the chairman with him to get some of the concerns that I have. Because these concerns, Mr. Chairman, are also tied into the CAO as well.
I can do that with you. No problem.
Okay.
You set up the time.
Okay.
Mr. Chair, if,
Problem with that?
no. 2 members of the board may meet together without violating the Brown Act to discuss substantive issues on behalf of the county. That no issues with that at all.
Okay.
Mr. Chair, assuming that we're done on that matter, I would like to address Supervisor Valley's concerns regarding my earlier interruption during public comment. I was referencing Government Code Section 54954.2A13, subsection A13. With respect to no discussion may be had regarding a non-agendized matter by the board. I did make 2 mistakes regarding that, and I appreciate the opportunity to clarify the record. That code section does include an exception. It says, except that members of a legislative body or its staff may briefly respond to statements made or questions posed by persons exercising their public testimony rights. I mistakenly stated on the record that it was not time for public comment. In fact, it was time for public comment. But what I meant to say was it was not time for board member comment, except in that very limited way. In retrospect, I also owe Supervisor Valley an apology for inconsistent application of the rule. In retrospect, I probably should have interrupted the chair of sharing your own experiences in a conversation manner with the public speaker who did not ask a question regarding what the board was going to do about it. Supervisor Valley, I will say in my own defense that I understood as you prefaced your comments that you were gearing up to speak in a very substantive way, as was, I think, suggested by the question that you posed to the speaker. But I would say to you, I owe you an apology, and I appreciate for inconsistent application of the rule. And I appreciate the opportunity to clarify the record on both points.
Well, I appreciate your apology, but I also just want to be clear moving forward to anyone within earshot. My district, it's not about me, it's about my district, and it will be represented. We could disagree with these gentlemen. I'm gonna win some, I'm gonna lose some. I'm a big boy. That's the way it is. It's politics, right, Craig? That's the way it is. But amongst staff, that will never be the case. Okay, I know my role here and I know my chain of command here, but that will not be the case because even you go back the other day, the sheriff, as he did again today, reported the board on a budget item and a concern that he has, right? As it relates to his employees. I didn't say anything. I waited till the day of the budget and I brought it up. And it was pointed out that now all of a sudden that this had to be a meet and confer issue, but it was never told in the 2 weeks prior when the sheriff brought it up that it had to be a meet and confer issue. I'm thinking it's budget day. This is the day we bring it up. I had a department head who publicly told us he had an issue. I want to have the conversation on my board and it gets denied. And again, it's a long list of how that applies. So I'm gonna accept your conversation, but hold you to it that you treat me the way you treat the rest of these gentlemen. And again, even on this issue, I don't feel it's fair because I've seen multiple times on a whim, somebody says something and boom, it just happens. But when I ask for it, now there's a process. And so there's not going to be no Richard Valley rule around here. That stuff ends and it ends today. So let me ask you this legally, since I'm being denied the respect to have the private conversation, can I air out some of my concerns publicly if that's the only choice that I have left as it relates to Ed Hill?
You may ask Mr. Hill any questions at any time.
Okay.
Comments and discussion regarding his performance should be held in closed session under the Brown Act because, please, I want to be responsive to your questions. Because he does have a right to privacy under the California Constitution. The Brown Act does provide that if the legislative body takes a performance issue into closed session, the employee has to be given notice of that and has the right to bring it into open session. So to the extent you're just asking questions, you can do that in open
Okay, get him
session.
on the line then. Get him on the line. I'm going to ask him some questions.
Mr. Hill, are you currently available to respond to questions?
Yes, Supervisor Valley, through the chair, I'm available.
Okay. And you're going to have to give me some leeway here too, is I'm not prepared with written out questions. So, but give me a little bit of leeway.
I will not interrupt any question that you choose to ask, Supervisor.
Okay. Mr. Chairman, I'll just say this: by a lot of this has went sideways in the last 2 weeks, and I want to clear the air here on here because it affects, I believe it affects my relationship with the board here, and unfairly. Mr. Hill, so isn't it true that I helped you with getting you an emergency addendum to the Avenal City Council meeting 2 weeks ago so you could have 100% their attention, their audience, for you to present bringing the National Guard and mobile testing to the city of Avenal? That's the question.
Supervisor Valley, through the chair, you had requested that I speak at that meeting. I believe you sent me a text asking me if I was available to speak at that meeting.
Yes. Okay. So I did that at the request of the mayor and the vice mayor of City of Avenal. Thank you. You appeared. So then the next question is, what was the, after you gave your presentation and let the Avenal City Council know that this was a National Guard that would be coming to do free mobile testing in Avenal, after they shared with you their individual comments and feedback they received from their community, was the vote in favor to have you come to Avenal, or was the vote for you to not to come to Avenal?
Supervisor Valley, through the chair, their vote was they did not want the resource in Avenal.
Yes, and the vice mayor, who's now the mayor, Alvaro Preciado, on tape, he directed you, his words were, please thank the Kings County Board of Supervisors for thinking of us, but please let them know we do not want the National Guard in our community. So my question to you is, why are you in Avenel against the wishes of those elected officials in the city of Avenel?
Supervisor Valley, through the chair, as stated by Mr. Sanchez, they requested that that resource be brought out there. They had indicated that they would be able to do so without being political or have any political agenda. They felt it was important to that community as well as their staff and the citizens and the teachers and the students. And then again, as mentioned in the past, it's been my drive to get that resource out to Avenal and out to those hard to reach areas, as I've mentioned today on several items. And then to your comment earlier about, politics aside, getting the resource where it needs to be, our purpose and our goal is to test widely. It's a directive by the state as well as by our charge. And so we worked with Mr. Sanchez to have that resource delivered.
Who initiated that request, you or Mr. Sanchez?
Mr. Sanchez. He also wrote a letter to the board last week stating the same.
Yeah, that's the other thing there, Mr. Chairman, as it relates to the CAO. I saw the tape last week, and she said that she didn't report out that letter during the opening of the meeting, as she normally does, but pointed it out to you guys when I was offline, and so I was never made aware of that. I never got a copy of that. Is typically, and so that plays into my displeasure here, where the district representative is being kept out of the loop on that. So, Mr. Hill, I'm going to ask you, if the city of Lemoore voted 5-0 to have you not come to have you not bring the National Guard to the city of Lemoore, would you override the Lemoore City Council and show up anyways?
Supervisor Valley, through the chair, again, if that's where the resource needs to be for us to complete our public health mission, I would work through those organizations to deploy that where that resource is needed.
And that's what I'm talking about, Mr. Chair, earlier when I said Mr. Hill he can't have it both ways. That's the concern here, that if he's going to be the public health director and say, I have a job to do and a mission to do it. I would be supportive of it, but he's only doing that in my district. He's not making any other moves, but he's going to play public health director in my district and go to a community where those elected officials that represent the community told him you would cause fear and anxiety if you bring National Guard to the city of Avenel. Here's the other right here. Mr. Hill, did you receive multiple requests from the mayor of Avenel, Alvaro Preciado, yesterday for you to call him back, for you to call him?
I received a voicemail from him around 5:30 in the afternoon. I was on state conference calls until late last night.
Okay.
So I did not get an opportunity to call him back.
Okay. Is the county CAO, Rebecca Hill, your receptionist and typically returns your phone calls for you?
Supervisor Valley, through the chair, no.
Do you know why the CAO called the mayor back and said, Mr. Hill's not available? I'm calling to find out what you want. Why are you calling him? Are you aware of that?
I had a quick discussion with Ms. Campbell, letting her know that the mayor was reaching out to me, but that I had other obligations and probably would not be able to reach him anytime soon.
Is that typical that you ask the county CAO to return your phone messages to, especially to elected officials?
I did not request that she do that. She offered and I accepted.
Yeah, this is what I'm talking about, Mr. Chairman. When you see me frustrated, it's because there's a lot. There's just stuff going on that I know you would not allow to happen in your district, and you wouldn't allow to have staff treat that way, meaning that the mayor of Avenel requested a call because he wanted to ask Mr. Ed Hill, why are you coming when we told you we didn't want you here respectfully through a formal vote. And Mr. Hill does not even give the mayor the respect of a callback to answer that question. And for some reason, the CAO returned that call to the mayor. Now the mayor calls me up and the mayor is insulted. I don't know what's going on. And I'm the county supervisor. And the mayor is saying, why is your CAO calling me when I'm calling the public health director? It stinks to high heaven, Mr. Chairman, that when we're talking transparency, that the public health director cannot call back the mayor. And it's disrespectful to the Avenal City Council members, and it's disrespectful to my district. That's just some of the things there that are taking place there that I wanted to have a private conversation to go in depth on. And so I'll leave that there for now, and I thank you for the time that you and I could sit down and talk with him. But I do want to have a talk with him, and I want him to be held accountable for some of these actions here that are taking place. And again, I have no problem. If he wants to apply this to the whole county, he should. I believe he should. He should tell all of us to take a flying leap off a cliff, and he's going to do his jobs to save lives in the middle of this pandemic and not wait for us. But I'm not going to let him have it both ways, where he is failing to take care of an area that he has told us many times where our outbreaks are, and he's not doing it, and he's hiding behind the fact that the board is not taking action on it. And I'm not going to let him have it both ways. And clearly that's what he's trying to do on simple questions here. And that's why I say I'm also going to come back. I'm not going to do it today, but there's going to be a conversation about the CAO, because that right there, that's not going to fly. Thank you,
Mr. Chairman, if I may.
Yes, sir.
Just to address Supervisor Valley's comments, I continue to push to have that resource out in those areas, and I would do it in any area. Again, that was the whole purpose and the whole drive behind having the National Guard resource deployed, because they could do it quickly, they could do it efficiently, and they could do it with sustainability. So I'm struggling with the comments that I'm using a double standard, because I'm applying it uniformly throughout the county.
No, I would disagree with you. So based on that, then why wouldn't you just return the mayor's call and tell him that?
Again, I had several conference calls that I was held up on, and I wasn't off those calls till late in the evening.
Yeah, well, in government, one of the rules is the biggest sign of disrespect is not returning somebody's phone call. And as an elected official, I live by that. I don't care if it's Joe Doe, the taxpayer, calling me up. I return that phone call and take pride in it. I would wish you as a department head in the middle of a pandemic, being the health director, would and could do the same. But moving forward, Ms. Chill, I look forward to having this conversation with you. I'm not going to disrespect you here in public, but this conversation is not over, and it's a conversation that needs to be held out of the respect for the city of Avenal, because for Corcoran tonight, I think it's a waste of time that you would appear on there and myself to appear on there based on what's taken place. Because if the city of Corcoran were to tell you that they didn't want the National Guard in the community, you're not going to listen to them anyways. And so it was a waste of time and disrespect for the city council members' time and the community of Avenal's time that we had that conversation 2 weeks ago, and you disregard them. And I would have more respect for you if you would at least return the call and let the city of Avenal, those council members, those elected representatives know what you were doing. They had a right to know, because they gave you their time and put you on agenda and let you make your presentation. That's a problem there. And it's a problem that you have the CAO covering up for you. And we're going to have that discussion with her as well. Thank you.
Mr. Chair, can I introduce a point of legal order?
I'm done. You can say whatever you want. I'm done talking. I'm over. I'm done. I said what I had to say. You can say whatever you want now. I'm done.
I would like to introduce a point of legal order that I think would be helpful to the conversation. It is this: the county's mobile testing unit was invited not to the city of Avenal, but to the legal property of the district of Reese Reef Sunset, which is a public school district, which is a subdivision of the state, which has plenary authority over the activities that go on its property. And as was pointed out by the letter that was sent last week, the superintendent of Reef Sunset invited Mr. Hill to bring that resource to their property, which they had legal right to do without any respect or regard for the actions of the city council. So I just put that out there so that we're clear on the record that Mr. Hill did not go there out of disrespect or disregard to the city council. And I offer nothing else, Supervisor Valley, with respect to all of the other points you made.
I agree with you on your legal, but you just injected an opinion that it's not disrespectful. And as their representative, the phone calls I'm getting from Avenel, they feel extremely disrespectful. And it falls back on me because they don't know the backstory. They just know that I was on the council meeting. I'm gonna look at you, Mr. Chairman. They just know that I was on the council meeting and I heard them and I heard their direction. And then all of a sudden, the county is over there. They don't separate it as Ed Hill. Some people just see it as Supervisor Richard Valley. I'm more known in Avenel than Ed Hill is. So because it's my job of the last 12 years, then it falls back on me. And I'm saying, I wasn't even aware of this. Why is this happening? And I would think, Mr. Chairman, that the CAO, when she got that letter, would at least reach out to the representative of the district to say, hey, look, I know Avenel City Council said this, but the superintendent of Reef Sunset said that they would like the testing out there. Instead, I'm out of the loop. She's returning phone calls for the health director. He's not responding. That is wrong. And do you think that would happen in Kern County or Fresno County? The CAO is going to return a call for the health director to a mayor of a city? What kind of small town Mayberry politics is going on here?
So if I understand correctly, if the Reef Sunset School tests more than 100 people, it's clearly the city council was wrong. That means because it's all voluntary, people go there on their own and get tested. No one's being forced to be tested. It's on the private property of the school. It's under the direction of the County of Kings, and it's asked for by the superintendent of the school. If people voluntarily go there and they test more than 100 people, there's a need to be tested in Avenel. That clearly shows your mayor of Avenel and the city council falsely understand what we're trying to do here. I keep hearing National Guard, National Guard, National Guard. It is a rented motorhome with 6 white tents with 2 young kids with fatigue pants on. The administration of the swab is done by a Hispanic girl in scrubs, and that's it. The National Guard people, which are young kids, they got to be 18 to 21 years old. They set up the tents and drive the motorhome. Our staff's there to follow, to get them to understand what's going on. I keep hearing National Guard, National Guard. I keep thinking there's going to be damn tanks and people full fatigues out there. This is just a rented motorhome with white tents. There's nothing that says National Guard on it other than the 2 young men have fatigue pants on and white t-shirts. And they both speak Spanish. Yeah. And just like the little girl that handed me the swab. I mean, I think there's a lot of misunderstanding of what we're trying to do here. We're trying to make this test easy and comfortable for the community. I don't understand what the city council was trying to do by telling us we can't come there. I mean, that seems to me like a challenge.
No, it wasn't presented that
If
like
the
that.
city of Lemoore said you can't come to city of Lemoore deal, I would open up my property and say, come on.
Yeah.
I'll do it. You can't tell me what to do. I pay taxes.
Yeah, it wasn't a challenge.
We're going to find out today. If they already had 20 by 9 o'clock,
yeah,
they can probably have 100 people. It's going to be the best. I hope we have over 100. It shows that there's a need there and the city council is wrong. And hopefully they get voted out of office for being hypocritical.
Well, Mr.
Now,
Chairman,
if someone calls me at 5:30 at night and demands a call back after I put in a 10-hour day, I can call them back tomorrow. It's no big deal. It was a request made by the superintendent of schools, Pat Sanchez. I called him directly last week to find out what exactly is going on. He did not return my phone call. I don't think it's disrespectful. I'm thinking he's too busy to call me back. I left him a message. Please give me a call. I'm the chairman of the board, King County Board of Supervisors. Please give me a call. If you want to talk politics, Press the Auto should have called me. I'm the chairman of the board. I call the shots, right?
I'm his direct,
You're
I'm his
chairman, you
direct,
call the shots.
I'm his direct representative. He's going to call me.
I'm the chairman of the board. I call the
Well,
shots.
with
And
all
you
due
saw it as you
respect,
see fit. So,
and following the chain, I brought it to your attention here today.
yeah, and I'm okay with it. I think it's a voluntary service that we provide, and you don't have to go get tested if you don't want to. Clearly, we have 5 board members, and I'm the only one been tested twice. You don't have to.
Yeah.
And no one criticizes you for not going.
Yeah.
But how can you be an expert if you've never even tried it?
Well,
I keep hearing National Guard. I'm tired of it.
Yeah.
You're a Marine.
Mhm.
Army, Navy, Air Force, Marine, National Guard, firemen, police officers, sheriffs, whatever, all uniformed people.
Yeah.
Got to show respect to.
Yeah. It's not.
If you're illegal or not,
Yeah.
they're here doing a job.
Yeah.
No one turned them away when they had fires in Shaver Lake.
Mhm.
They accepted their services. They're just 2 young kids sitting there typing in the information as it comes across the internet. So
Yeah. No,
I don't
you,
understand where Prestiato comes across as, demanding a call from somebody at the last minute.
I wasn't last minute. Ed said that, it was earlier in the day. And I know they were early in the day because he reached out to me. It wasn't at 5:30, but all I'm saying, Mr. Chair, to answer your question, could Avenel be wrong? Yeah. All they're asking for is let them be wrong. They're the electeds. And so what they said that night was okay, but we are in the bigger picture of it.
Let them be wrong, then every one of our businesses stays closed.
Well, that's my whole point, though. That's the whole point. That is the whole point, and that's what's so frustrating.
The biggest point here is that you weren't successful in getting $1 million and you're
Really?
pissed off.
Really?
Yeah.
Have I displayed that here today in my conversation? I have not.
I told you from the first day I met you, I said, Richard, I'm going to respect your opinion until you do something wrong. And I've been sitting here trying to be quiet and do this, but you're acting like a bully.
Really?
You've been acting like a bully lately.
I'm acting like a bully?
I treat you with professionalism.
And you get it back.
Yeah.
And you get it
Well,
back.
Sometimes, but there's a point where I adjust my opinion just like you adjust yours.
Mhm.
And I'm telling you, you've pushed your position.
My position is your
That's why
position.
all of, this mess occurs.
Yeah. Well, my position is your position. I'm a county supervisor just like you.
That's right. And I got a vote just like you.
Yeah.
It takes 3 to do anything.
Yeah. No, that's right. And I'll remember that moving forward too.
Right on.
Because there's some 3 votes. I have some people up here, and I'll remember that. Mr. Chairman, again, all I'm doing is relaying what came out of my district to me, and I relate it to you.
And I hope the
That's it.
community steps up and shows the need that service is needed in Avenel.
And you know what? They have a very good chairman of their school board that I talked to last night. He's a good friend of mine. His name's Lupe Chavez. I have no doubt that he will be pretty successful. He told me about the advertising they did, the outreach they did to the parents. And I would hope that with the work that he put in, him and his school board, that they do have a good turnout. But again, the conversation, not knowing a lot, like we know more today, not knowing a lot based on Ed Hill's presentation to the council, they made a decision. And I think it's just fair to question, why is our decision not being respected, and not even being respected in the form of a return phone call? Just tell us what the hell is going on. That's it. That's long and the short of it there.
Mr. Chair, if you'd like, I can comment on what happened last night.
Sure.
So around 5:15, I was talking to Ed about the EMS contract. He had calls coming up. He mentioned that Mr. Preciado called. I'm trying to be helpful to Ed. I know he's very busy, and I offered to call him back, so I did. I heard out his concerns, and I shared those with your board today.
Yep, and I was in her office when he called, when I walked in and she was on the phone with him. I overheard the last couple minutes, and it was all professional. And she said she would share his concerns to Ed Hill. I reached out to Ed Hill, and I got a phone call back. I think he was done about 7 o'clock last night, and he really didn't have time to talk. But the initial effort was made to go to the city of Avenel by the request of Reef Sunset School Superintendent. And, us to tell him no would defeat the purpose of us needing to get test results. I still think we need 200 a day to prove that we can utilize the service.
Yeah, and we're falling short.
We're falling short. So that's why I got tested, and I will get tested next Monday too. So, I don't think we're trying to be disrespectful to the city of Avenel. I just don't understand, when it's a voluntary service, You don't have to go get tested if you don't want to. It's simple. I mean,
Well, Mr. Chairman, it's a shame that that perception is there, but we can't, to be just as fair, you can't blame that on the city of Avenel. There's a lot that's been on the news relative to National Guard and in those uniforms as it relates to separating Hispanic families, separating non-Spanish, English-speaking families. And that's what those elected officials in Avenel relayed to Ed Hill. Okay,
Yeah,
so they could be wrong.
when
They
National
could
Guard's
be right.
gone, we'll go back with our people.
Yeah.
I mean, that's just where we got to use it today. We got to fill what the community needs, and we'll see if no one shows up there today and it's under 12 DACII Palace. I mean, clearly only had 12 people on Sunday.
Yeah.
That was a waste of time.
Yeah.
So if we only get, well, we already got 20. So hopefully we'll get up to near the 100 mark.
I actually just got a text from someone who's talking with an Avenel planner, and they're at 80 right now.
80 right now. So it just show a need that maybe the city of council of Avenel made a mistake by addressing the concerns of the citizens without actually giving the citizens a chance.
Mr. Chairman, they're not saying that they don't need to be tested. Ed Hill said they need to be tested. The majority of Avenel is farm workers. There's no argument they need to be tested. I hope there's 300 people there today. There was a concern on a perception there. Now they could be wrong about the perception. Let's be fair about it. But they gave Ed time and they had to talk and clearly it was a waste of time. So, but again.
Well, this is not a one-time deal. We're going to need to do this once a week, 3 times a month, something like that, until we have a vaccine. This may be going on until June of next year.
Yeah.
So we need to build a relationship and move forward. And I don't know what happened with city council. I was not on the call, but I think we need to have a sit down with them and explain it. We're not trying to hurt them. We're trying to help them.
Yeah.
And the fact that the citizens of the community came forward and got tested voluntarily proves that there is a need and there is a want that they want to be tested.
Well, if the population is what Ed said this mobile testing's for, which is go solve the problem in the outbreak, then so be it, right? But if he's testing here at the government center and testing employees, that's not the population that he said he needed this for. Now in Avenel, if the parent is coming with a student today to test, 9 times out of 10, that's probably going to be a farm worker family. And I'm happy about that because if those family members aren't infected, that is a good chance that means that farm worker that lives with them is not infected. And so that's all I'm trying to say to my colleague, Sue Peterson. That's all that I care about, whether it costs $1 million or free, as long as it gets done. I don't know how much clearer I could be about that. That's it. Unless, words you're speaking. Yeah, no. That's all. All I can do is go off my words here, my actions here before you. Now, I think the problem is, and what was relayed to me, the perception is that I wanted the contract to go to a certain party. And that's what I'm mad about. That's an opinion there. Okay. And if someone feels that way about me, that's kind of a little bit of insulting too, because clearly I don't have the power to give somebody a contract. It's a discussion up here amongst you, and that's it. And you win some and you lose some. And that's it. That's there. So it's no I don't understand how you're being
You didn't let it go. You didn't let it go. And you specifically went in and tried to affect the outcome in a different way. That's what's insulting.
I don't believe I did. I wanted to ask a question. Which council told me if I asked the question, it causes me to be removed from the conversation last week. So out of respect, I removed myself from the conversation.
Well, out of respect to you, I'm not addressing the issue of whether you had a conflict. I'm addressing the issue of once the vote was taken and it was decided that wasn't going to happen, $1 million extravaganza, then something else started to occur, which ensured or tried to ensure that testing wouldn't occur. And I'm just, sorry. But
Okay. So to air it out, do you think that when you say the action that I did to ensure the testing doesn't occur, do you think that I had the Avenal City Council vote to not have the mobile testing come. Is that what you think?
I have an opinion. If you wanna
Okay.
Chat about it. I'm wide open. As I told you, we'll adjust our.
I can't get 4 votes here. I don't know how I'm gonna get 4 votes at the Avenal City Council to make them do something they don't want to do.
Go get tested.
You know, I'll go with you. Let's try.
I got tested yesterday.
Okay. All right.
Okay.
Well,
You want
thank
more
you for
discussion?
hearing me out. Apologize to the board for that lengthy, but I was hoping.
That's why I seconded it. I thought we should do this in closed
No,
session.
I thought so too. It is what it is.
Okay, we're good? All right, we'll move on to administration again. Rebecca Campbell, Department of Health, Ed Hill,
Okay,
1A.
so this is a weekly update to your board on the COVID-19 pandemic and the status. I will first go over state and federal actions for the past week, talk about the county. I will then turn it over to Director Ed Hill. He'll give an update on the public health side locally. And then I'm going to turn it over to Economic and Workforce Development Director Lance Lippincott, and he will give an update on the small business program. So first off, just a few things that happened last week at the state level. The first round of home key awards were announced. Kings County was not part of that. Our closest county to be announced an award was Kern County. So there's 10 projects in 7 counties to purchase and rehabilitate housing, which includes hotels, motels, vacant apartment buildings, and other properties. There is more to come on that, but if you recall, the home key includes $600 million in the federal coronavirus relief funds that are going to be distributed to counties, cities, and housing nonprofits for purchase of properties prior to December 30th of 2020. So there is more to come on that with our county. We'll bring an update eventually to your board. The California Department of Housing and Community Development Agency announced that it will amend the notice of funding availability for the Community Development Block Grant Coronavirus Response Round 1. The amendment will extend the deadline for those jurisdictions that received a reservation of home key funds to purchase property and are considering using federal funds to improvements for the properties for move-in ready. The governor signed some protection measures regarding COVID-19. One requires employers to provide written notice and instructions to employees who may have been exposed to COVID-19 at their work site, and enhances the Division of Occupational Health and Standards, or CalOSHA, ability to enforce health and safety standards to prevent workplace exposure and the spread and to mitigate the spread of COVID-19. Another codifies Governor Newsom's executive order on workers' compensation presumptions related to COVID-19. And another action that was signed expands the scope of the California Family Rights Act, CFRA, to prohibit employees with 5 or more employees to refuse to grant an employee request to take up to 12 weeks of unpaid leave for family care and medical leave related to COVID-19. On the federal side, President Trump and the USDA recently announced a new round of funding for the Coronavirus Food Assistance Program, or CFAP, which provides assistance to farmers who continue to face market disruptions as a result of the pandemic. And starting yesterday, producers will be able to apply directly to USDA's Farm Service Agency for federal aid, with applications accepted through December 11th. Also, USDA announced that it would extend more than a dozen flexibilities to ensure that the women, infants, and children beneficiaries continue to receive the nutrition support they need during the COVID-19 pandemic. The county continues to meet. The County Emergency Operations Center is continuing to meet weekly. The county continues to take steps to reduce exposure to COVID-19, operating with some of the closed lobbies. That hasn't changed yet. There will be some upcoming lobby changes and programs related to the library, elections, and the agricultural department that we're working on. We'll bring that back to your board. And we still have several resources on our website. We have the health page, the community page, which has the small business program, and we have the reopen page. As we're getting and receiving updates from the state, we're putting that information out through our web pages. So at this time, I'd like to turn it over to Director of Public Health, Edward Hill.
Thank you. Thank you, Mr. Chairman, members of the board at Hill Public Health. I'd like to start off again with going over the basic practices that we can all do to help spread or help limit the spread of communicable disease, such as wash your hands frequently for 20 seconds or more, don't touch your face with unwashed hands, stay home if you're sick, stay hydrated, and cover your face with face coverings. Our current numbers for the county, we've tested 423 individuals. This number does not include inmates. I'll get into those numbers later on. We have 347 results pending. We're currently monitoring 2,519 individuals. Our current total cases for the community is 4,015. Unfortunately, we have 47 deaths. Total recovered is 2,804. Active cases are 1,164. Our skilled nursing facility in Kings County still have a total of 173 cases with 12 active, 137 recovered, and unfortunately 24 deaths. We continue to work diligently with them, the California Department of Public Health Infectious Control Unit, and licensing and certification on their processes and any assistance that they may need. The state prison outbreaks continue. Their total current cases is 3,346. That's 422 at Corcoran, 2,604 at ASP, and 320 at SADF. They have tested 31,972 times with 44 results pending. Their current active case is 1,343 with 1,997 recovered, and unfortunately 6 deaths. There are 3 individuals hospitalized, but none of them are hospitalized here. The spike at Avenal State Prison and SADF are occurring again, respectively 160 new cases at Avenal State Prison and 56 new cases at SADF in the last 2 days. It had looked as though this was tapering off, but again, I was not optimistic that it would be able to be maintained, and I was correct as it's picking up again. I'd also like to take this opportunity to provide an update about our numbers. As stated in the past, we've always separated out cases associated with prisons and skilled nursing facilities. This included their staff, which is not how the state counts these cases. The state only removes the inmate population from the county numbers, and we have done this in the past because we're making the case that these are state agencies and the cases are associated with them and their processes. And we wanted better mechanisms in place at these facilities, as well as better mechanisms for them to quarantine their staff members. However, as mentioned in the past, we are going to modify the way we present these cases moving forward with the addition of our EPI team. Because of this, we will be there will be a change in our overall county case count as we add these staff from the skilled nursing facilities and prisons back into our count. These will not be new cases, but there'll be a jump in our total cases of about 200 individuals overnight. But I wanted to make sure your board was aware of that before we make that change. We'll likely issue a press release as well. And then since many of these individuals are part of the CDCR system with a high proportion of them being male, it will likely adjust our gender numbers, bringing that value closer to 50-50 distribution, which we're seeing across the state. We continue to watch hospitals data closely. We continue to see a slight decrease in hospitalizations locally and regionally. This is good news as we prepare for flu season. As of yesterday, there were 21 hospitalized individuals with 2 in the ICU in our hospital here, with 8 of them being Kings County residents. The Porterville Development Center, which was the alternate care site, has been closed, but it remains in what they identify as a warm state, which means it can be opened back up in 72 hours. To my knowledge, this facility is completely empty. Last week, they were still in the process of cleaning the facility, but that staff is completed. Now they are gone. Again, this is an area of great interest to us at Public Health, given the outbreaks at the prisons and the likelihood of it overwhelming our healthcare system. We're currently maintaining a 60-day supply of PPE still for our healthcare facilities. Our EPI team has been hired and onboarded, and they continue to work with the state's EPI team to get aligned with all of the new systems, data requirements, and processes. This includes acquiring the code that's necessary to run the data so that we can match the state's data as close as possible. However, I need to be very clear here that the state has made it clear that we will never, or the counties will never be able to pull the identical data as the state due to multiple variables such as when the data is pulled, how many are electronically reported or manually reported, and so on. We're working to get the team the software systems and equipment that they need to be successful, but they've already begun to work on our data systems and processes to identify gaps and process changes that we need to implement. Just as a reminder, we have never had an epidemiologist or an epi team, and this is a good thing, but because of this, as we get deeper into the data, our data will change, and I'll make sure I point those out when they occur. Our program that is designed to support the essential workforce and their isolation and quarantine needs went live last Tuesday, and since it went live, the program has served 2 households, and I'll report this out on a weekly basis on this call. We have scheduled our regular follow-up call with the state unified support teams. Those calls will happen every other Thursday. And then my last item is a couple weeks ago, the state rolled out their new color code system on their tiers. We are still in the purple tier, which is the most restrictive. Also, as mentioned earlier, due to our new case count and our testing abilities, our new cases per 100,000 was 8.9. But because we tested more, the state adjusted that down to 7.5, and our testing positivity is at 4.7. Again, I went over this during the testing discussion, but the state will be releasing new numbers today, and our new cases per 100,000 is at 8.5, but it will be adjusted down to 7.2 because, again, we are testing more than the state average, and our reported positivity rate will be at 4.5%. Also, as I announced last week, it's still in the works but we're anticipating the state will announce another metric that focuses on equitable distribution of COVID testing, response, and support for underserved and vulnerable populations. This process still hasn't been completed yet, but I think they're getting closer to it. Currently, the discussion remains that it can affect our local scores if efforts aren't made in these respective areas to drive down those rates. We know that the process that's been presented so far is pretty technical, and when we find out what is being finally deployed, we will provide an update to this group. And then may even have the EPI team come on and explain that process, because again, it's quite complicated. This concludes my report, and I'm happy to answer any questions.
Thank you, Ed. Any questions or comments?
I just have one, Mr. Chair. Ed, since they're making you report the positives, are they gonna go ahead and combine the total test at the state correctional facilities? Because according to the website, they've conducted 31,972 tests. And when you combine that to the county, that means a total of 73,000, a little short of 400, 395 tests have been done in the county. Is that gonna be added to the report as well, or just the positive cases?
Supervisor Nez, through the chair, they will only add into our count the staff, not the inmates. So the staff that test positive and negative should be added to our counts. As we brought up at the Unified Support Team, we're still working hard with the vendor for that facility, or excuse me, all the facilities actually, to timely input that data into CalReady. Our representative from the state, Trudy Raimundo, is working hard with the CalReady team and with CDCR to make sure that occurs. But to once again clarify and answer your question, we will only be given credit for CDCR staff, not the inmates. So they'll have to separate that out.
Yeah, and that's not separated out on the website, but yeah, staff, and I used to know the ratio, but I'm not sure the ratio now. But so that the testing will be part of the reporting as well, not just the positives?
I'm sorry.
Of staff?
I'm sorry, I was struggling to hear. Could you restate the question?
The testing of staff will be added to the testing reporting that's given to the state, not just the positives? The total number of tests conducted, not just the positive side?
That is correct. Those results, tests, and samples collected and the results should be entered in the CalReady state system.
Okay, and Is there a way that we can separate that out on your dashboard website?
That is correct. When we make the change, moving the positive numbers for the CDCR staff and the skilled nursing facilities, we will add those numbers into our community numbers moving forward.
Okay, because the report that Amanda gives yesterday, the state has been putting the corrections facilities, and they do break it out, inmates versus staff. But it's not, they don't report the positives. They just report the number of people tested, I believe. And I'll have to go back and look at that report again. Maybe it does say positives to total tests given.
Yeah, just so that I'm clear, Supervisor Neves, you would like to see us break out the tests being done for CDCR staff as well as the positives and negatives out of that population?
Correct, because if the state wants us to test more and they're testing more, we should add that to our total.
That is correct, and they actually do a process known as serial testing where they test that staff on a reoccurring basis every week or so, and so I agree we would and should get the credit for that.
But don't the hospitals and long-term cares also, as well as schools, doing that same serial testing?
The skilled nursing facilities do serial testing for their staff. The hospitals do as well, and yes, those are included in our community counts.
So I've just been somewhat disappointed in the state in not, they want to keep everything separate, but yet they add the positive numbers. And I just want to make sure that the total test conducted should be a part of that equation. And I'm still a little bit concerned because even the inmate population, because that is a part of our overall census of population, county population. And so I don't understand their logic in not counting the inmate population, even though it has a very high positivity rate. It is a part of our census and it is a part of that number that they're holding us to a higher accountability. Thank you, Mr. Chair.
Any more questions? Mr. Valley?
Yeah, thank you, Mr. Chairman. Mr. Hill, I'm on the county website. I'm looking at the new data, the breakdown of the how the COVID virus is affected by race and ethnicity. Thank you for that, by the way, for getting that out. Have you publicly reported out these breakdowns to the board? Did you do that last week when I was offline, or I don't believe you had it last week? Have you spoken publicly about these percentages?
No, thank you, Supervisor Valley. That change was just made last week on the 17th, so it was after the last board meeting. And then I did not report them out today, but I can.
Yeah.
I'm sorry, he drifted off. What was it?
Yeah, and I think that, as you pointed out before, I think that's going, because are the state correctional numbers part of that pie chart?
That is, I'm going to have to get clarification on that, but right now I'm inclined to say that is not, that the inmate population is not included in the race and ethnicity pie chart. That is only for our constituents.
But even gender, because that could account for the gender inequality, because the 3 facilities in Kings County are all male.
So that is correct. And that's what I had tried to cover earlier on in my update on the data. We have not been counting the CDCR staff in our community counts. We are changing that because that is how the state counts them. So we will anticipate the number of males versus females in the disease transmission to increase and come closer to 50% once we make this change.
Correct, and that makes a lot of sense, to be honest with you. That separation has been creating a problem.
Mr. Chairman? Yeah, Mr. Chairman, I'm looking at this, the breakdown here, and 66% of the COVID infections in the County of Kings are to Hispanics, Latinos, 13% to white, And so if I've come off as a bully, I'll apologize for that, because then I'll try to be a little bit more professional myself. But I think Sue Peterson is a little bit right in that judgment, because I am angry. I'm angry that this is disproportionate, not just in Kings County. I'm not saying it's a Kings County thing. The state and across the country, Hispanics, their numbers are higher, and there's reason behind it. There's science behind it. And when I wrote that letter to the governor, I was actually bragging. And when I went on Ray Appleton's show and on the Sunday Morning Matters, I was bragging about our efforts. I said, Kings County, we allocated $1 million. We're going to take care of our ag industry. We're going to take care of our farm workers. I was proud of that. And so, between there and today, there's opinions formulated and harsh words and whatever. Okay. But this right here, Mr. Chair, is the reason why, because as a Hispanic, I read that and I read across the country, what are the challenges? Why is this happening? And where you see where, whether the state or the counties or in the larger cities, city councils are dropping the ball. Hispanics are angry, Mr. Chair, that because they're aware of this. Now, this is the first I've learned. I just looked at this right now in preparation for this part of the agenda, because I was reminded that Ed said he would have this out by today. This right here, Mr. Chair, sometimes I feel bad when I'm talking long-winded on COVID. I damn sure don't anymore, because we have to do something, whether it's our population base is largely Hispanic, okay, but at the same time, it shouldn't matter whether it's Hispanic, black, white, or brown. We should be treating the issue. And clearly, the data is showing we are not handling the issue. And so I would ask Mr. Hill, why can you enlighten the board with your professional opinion based off data and science, why you feel the COVID infection rates amongst Hispanics in Kings County is so disproportionate to other ethnicities?
Supervisor Valley, through the chair, it's my opinion, and from what we've seen from the data, this population lives in a multifamily household, multifamily generational household. They also have a migratory work process that often puts them 4 and 5 to a hotel room at a time, which makes it difficult for them to isolate and quarantine when they are identified or when they are positive, which is why we created the Kings Cares Essential Workforce Support Program to facilitate that. As mentioned in the past during my report, I mentioned that we are supporting 2 families right now. That is one of the big keys. The other key is more testing, as we've discussed earlier, getting the testing out to those areas so that we can identify the outbreaks earlier and then get them into that isolation and quarantine and support program. That program is probably one of the most aggressive programs in the state, and it was designed specifically for this reason.
Do you feel that Hispanics should be alarmed by this percentage?
Yes, I feel they should be. Again, it also indicates that they are getting tested. I mean, probably not in the proportion that we would like them to, but obviously if they have a high positive rate, that means we are testing them and that they are coming in as positive. Again, to drive home the point of why testing is so important and why widespread testing is so important is so that we can identify them early, provide them with the support that they need so that they can isolate and quarantine effectively without the fear of loss of salary, loss of home, or loss of utilities or anything along those lines, which is why we executed that contract with KCAO. And again, it's a program that was designed specifically for this, because this is where we're focusing our attention.
Ms. Hill, and I'm not chastising you here. I already had my piece with you. I'm trying to understand you, though. You said that the high percentage, 66% of Hispanic COVID infections would have to do with the fact that we're testing a lot of Hispanics. So when I flip over and looking at your pie chart, you have it labeled white. 13%. Based on what you just said, are you saying that whites aren't testing at the rates that Hispanics are testing?
Thank you for
It's
the
confusing.
opportunity
Yeah.
to clarify.
Thank
My
you.
point was that the testing shows that it is widespread throughout the community. As I pointed out in the past, that we have over 32 sites that are available to get tested within the county, not including the mobile site, which we just deployed. My point for bringing that up was the fact that we do have 66%. It does show that we are testing. It doesn't show that we are testing them in any great quantity over any other population, but I just wanted to be clear that the testing is occurring countywide and that infection rate, as we've discussed in the past, is higher, like it is in much of the other counties in the Central Valley, which is why we created that program and are focusing our attention on it.
Okay, I'm gonna allow you to walk that back because I'm not trying to argue with you or insult you, but as long as you're clear that you're not saying that that percentage is only attributed to the fact that Hispanics are being tested, because there would be a whole lot of questions on your data based on that. Mr. Hill, can you just be more direct? Do you feel that based on your publicly identified outbreaks of COVID infections in Kings County, being the dairy industry, the ag and the farm workers, those essential workers in ag industries, with those outbreaks being known to you, do you associate that in any way with the 66% Hispanic infection rate in Kings County?
Supervisor Valley, through the chair, I am stating that is one cause and one opportunity for those numbers. Again, we don't have a great understanding of the work or their work assignments. As mentioned in the past, it's not a required question. In fact, a lot of individuals answer that result or that question on any testing that they do supply, sometimes as unemployed for the fear of it getting back to their employer. Other reasons we can only assume, but that is one area where we are seeing transmission for those who have identified that is their area or their line of work.
Okay. Ms. Chair, this is the last I'm going to refer to the RFP here, just so we can move forward. Supervisor Peterson is right. I was trying to steer it in a direction of a good plan that Ed knows the plan to bring this number down. He knows it because he worked on it very thoroughly for just over a month when he thought he could sole source it. And so I know that good plan is out there and he knows it too. But because we had to go to RFP, then it comes down to a vote on who gets the contract and who has the best plan. So I was trying to steer it to the best plan. I will say that. And so if that offends my colleague, then I'll apologize to you, Supervisor Peterson, but I am steering it to the good plan because this breaks my heart. These are, man, I'm Hispanic. And like I said many times, I'm the son of a farm worker. And I know that you care about farm workers. I know everybody does, because without a strong, healthy workforce in ag, we're not going to have a strong ag economy. And all I want to do today, Supervisor Peterson, moving forward, is work with you guys to bring this number down. I don't care if it costs a penny or a million or it's free. I just want to work with you so we could do this, because this man, it breaks my heart to see these numbers here. And I think that we can and we should do better, not to be throwing out things that everyone says, but we know that we're only as protected as our most vulnerable. And the most vulnerable are these Hispanics, these workers that need some help. Maybe testing is not the help. Maybe it's the vaccine, whatever it is, they are the most vulnerable. So we can't sit here and go, wow, we're protected because we live in a nice house, or we don't live in multi-family housing, or I'm not squeezed into a motel room with 3 families. We are just as vulnerable as they are. Am I right, Mr. Hill? And when you talk science and data, isn't that the way we should look at it? So we just have to concentrate as leaders here to move towards helping this group. This data, I hope it goes out in a press release because people in Kings County need to know about this. And Mr. Chair, I'll say this respectfully. When I heard from members of this board that small businesses were suffering, and some of them being people that you grew up with, went to school with, and know personally, and that they were losing their life savings, I heard you and I responded for 5 million. I'm only asking whether it's the million that we originally voted for or even less. I'm just asking for people, those small businesses are very important to you. You made it clear passionately, and I heard you and I helped. I'm only asking for the same for people that are important to me. These are my people. I'm Hispanic. Their blood runs through my veins. My parents work these crops here up and down the valley. My parents met at a farm labor camp in Corcoran when they were children because their parents migrated here. That's why I'm here. And for me to be one of them and not be vocal would be a sin to me and to my people for not expressing what I've expressed. So I want to hit the reset button. If I've offended anybody, I'm sorry. I want to work with you. Let's move forward. But we have to do something about this, Mr. Chair. And if Avenel comes back and says the National Guard wasn't an issue and it's successful, which I hope it is, then let's figure out a way to do it better. And let's do it. And I'll see if the churches will let me bring the National Guard. We'll find a way, but we have to do something. And if it's not testing, maybe it's the vaccine and helping them get it first, but something has to be done with that, Mr. Chair. Thank you.
I think we're on our way. It's going to be here for a while, so we got plenty of time to fine tune it. Yes, sir. Supervisor Peterson.
Yeah, well, I mean, I just respond a little bit, tit for tat here, but, you know, I'm not trying to see color. I'm just trying to see health and trying to do it in the most effective way. And so I think that's what the goal of everyone is here. And you know, I mean, when you talk about high Hispanic rates, we just talked about it a second ago, offline with Supervisor Valley. But it's been clear for some time. I mean, you look at the congressional districts, it's a 70% Hispanic population. I mean, that's just a given. And so I think the numbers probably match the population numbers in the district, and they're actually a little less probably than the positive is a little less than the actual population rates. But again, that doesn't matter to me. I want an effective tool that uses the funds that are you know, hard earned and hard to come by in the most effective way. And if we have differing opinions, that's okay. I just soon have a good relationship with all of you, but that's not why I'm here. I'm here to represent my district, and you're here to represent yours. So thank you.
We're good?
Mr. Chair, just one more.
Oh, yeah, good.
Just be fair on that. You go back, what does that say? 1893. Arguably, there may be one supervisor who disagrees with it, who's not sitting here, but the morning that I woke up in 2008 and I got elected, the Fresno Bee said last night, Richard Valley made history in Kings County by being the first Hispanic elected to the Kings County Board of Supervisors. The reporter called me later that afternoon and said Supervisor Tony Barber called him and chewed him out and said that he was the first one. I wasn't, my whole campaign didn't have nothing to do with that. I didn't even realize that. But what I'm saying is, to the point that Hispanics are the majority in Kings County, right now on this board, there's only one Hispanic. I think I won't insult anyone, but I believe I'm the only Hispanic on here. And if Supervisor Barber is Hispanic, I mean, he told me, because Barber called me too, so I'm gonna take him for his word. He's Hispanic, according to him. There's only been two. So all I'm saying is, Hispanics look at these numbers and they can talk about, you know, the representation. You know, if there was 5 Hispanics on the board, there might have been monies already moved to go get Hispanics tested. I'm not saying that's the point. I'm saying devil's advocate of what I hear from my community, but there's not. There's only one Hispanic on here. And in fact, the one Hispanic who was on the issue of mobile testing to test them last week was asked to recuse himself from the conversation. So they have one voice up here and then that voice was silenced last week, and that's not going to happen again. But that being said, that's why people are angry or they have their guard up, the case in Avenel. And that's why I do too. Because like Sue Peterson said, the closest people we represent are our districts. After that, we're supposed to be a team and represent Kings County wide too. And I agree with that too. And so again, I sure as hell hope we could work together as a team to move out of it, because color or not, the data shows Hispanics are infected, and when this goes public, Pete, there's going to be a lot of feedback about that.
We're in Avenel today, so tell your friends to go vote. Go test. So
go vote and go vote.
Yeah, so I think it fits the percentage of what the county's based off of. I just looked on the online, and 55% is Hispanic, 31% is non-Hispanic. So it seems
Those are 10-year-old numbers.
Yeah. So I know it's going to be up to probably.
Yeah.
Is that the way?
Only people I know have been affected were, I know one Hispanic gentleman that was affected, but the rest, were, a lot of Portuguese. I don't know what they consider.
Hey, Mr. Chairman, can we ask Ed on the science? Is that how they look at this? The population that if the population's majority Hispanic, is it correct to assume they're going to have the highest infection rates? Could we get his?
Yeah.
Ed, I don't know if you caught that, or if I got to put it in question, but if you're listening to the conversation, could you interject?
Supervisor Valley, through the chair, having one population higher than another obviously does affect the rates, but that's not how we look at it. We look at where the disease is moving and where it's being transmitted.
Okay, thank you for that. Thank you, Mr. Chill.
Okay, we'll move on now.
Actually, we have Economic and Workforce Development Director Lance Hill standing by to give an update on the small business program.
Okay, Lance, you're there?
Lance.
Yes, sir. Yeah.
Thank you for waiting.
Yeah, no problem. Wanted to report out, as per your instruction, at the July Board of Supervisors meeting on the current status of the $5 million Small Business Assistance Program. Currently, we have in process and checks issued in the following amounts: $215,700 out to the unincorporated areas, $56,500 to the city of Avenal, $215,526 to the city of Corcoran businesses, $345,300 to the city of Lemoore businesses, and $774,850 to city of Hanford businesses, for a subtotal of $1,607,876 that are out as of 11 o'clock yesterday. To put that in perspective, we've received a total number of applications totaling about $7,257,876. So far, all four municipalities, Avenal, Corcoran, Hanford, and Lemoore, we have sufficient applications for each of those areas to disperse funding up to the limits of the allocations that were originally imposed. However, unincorporated area, we're estimating that it's going to be underspent by about $584,300. What we're asking is for some direction, whether or not we can move one into phase two, which is the second $2.5 million, and two, whether or not we can utilize the funding that is currently set aside for the unincorporated areas to pay, to distribute to per capita to the municipality businesses to fill a few more of those applications while still preserving priority if we do receive any unincorporated applications in the future. Using the awards already issued as a benchmark, 79.7% of all applications received the maximum award of $20,000, with all other applications based on our formula we use internally receiving some lesser amount. Is there any questions on this program? I know that was pretty quick.
Good question. Supervisor Valley?
Yeah, Mr. Chair, in the essence of time, I want to again thank Lance. I went to his office, I think it was last Friday. I went in there personally, and I thanked him and his staff for the good job that they're doing on this. It's a lot of hours to do this. I think they're a model moving forward on how programs should run when the board entrusts funds to certain entities. They're doing an amazing job, Mr. Chair. That being said, though, in the essence of time, I get what Lance is presenting to us, the 584,000 out of the money we allocated to the unincorporated areas. And for some reason, it sounds like those businesses did pretty good during the shutdown. And looking at Hanford and Lemoore, they need more help, Mr. Chair. And I mean, we allocated $5 million. We felt good about it, but the need is over $7 million. So I'm very thankful that $5 million is there. If anything, later down the line, we take a look at probably just having a discussion on more, but definitely not less. I'm so glad we didn't do 2 million, that we did 5. So that being said, Mr. Chair, for one of his asks, I'd like to put a motion for discussion to the board that we reallocate the 584,000 from unincorporated, and let's send that over to Hanford and Lemoore, because if I'm hearing Lance right, just on the first 2.5 million that we authorized him to cut checks on, he's holding off right now. And there's businesses that are hurting, and him and his staff want nothing more than to call that business owner to say, come pick up your check. And I think we should help them with that. And so if we give them a little bit of relief with a buffer zone, let's do that 584, Mr. Chair, for Hanford and Lemoore. I think Corcoran's okay. I appreciate him putting Corcoran in the loop. But I think Corcoran's business model is there is a need. We had in the last week a lot of applications come from Avenel and Corcoran, and I credit that to the chambers and Lance and his staff for putting the word out that this program exists. But that being said, those business models, I think they were models where they could stay open, and they did, and they made some money. Hanford and Lemoore, clearly, they're hurt, Mr. Chair. So my motion would be to reallocate the 584,000 for Hanford and Lemoore business owners that are in line right now to get their checks.
Do I have a second?
No, because the cities have their own CARES amount of dollars, and I think we did set it up to where they can't double dip. I think the rural areas are just a little bit slower. And I would like to keep it in those rural areas a little bit longer and let the cities go ahead and disperse the funds as they have. I don't think it's the county's responsibility. I think we stepped up way above the plate where we're at. But I think we need to allow the cities to go ahead and distribute what they have.
I could modify to that, Mr. Chairman, not Mr. Chairman, Seat Nez, because, you know, obviously we both represent unincorporated areas too, and I get that. But the reason why I'm fine with, you got to give them the money too if you give them the gavel. The reason why I was okay with it, Supervisor, was that I heard Lance say that even if we reallocate, if Armona, Stratford, or Kettleman unincorporated came in with a latecomer, that then they would be still they would still be priority with this money, even though we moved the labeling of it. And I don't know if that works for you, but if not, what if we reallocated 300,000 and left 184,000 there for unincorporated for right now, with the caveat that even then there's still a priority with the 300,000 we move over. But it sounds like Hanford and Lemoore that they passed and they're due a check, but fiscally, Lance and his staff can't cut it. And I know that's the second half of this question. It's probably going to be a Rebecca or our financial department head question on if he could go ahead and move into phase 2 and start working on the other 2.5 million, because we told him only go up to 2.5 million, save the other 2.5 for the second part. But obviously, it's no secret the businesses are hurting and they're looking for the help now. So would that be something that would help you?
I would still like to try to keep the rural areas as whole as we can for right now. Allow the cities to go ahead and distribute their CARES money as well. And I think we'll have plenty of time. You know, because again, the the rural areas just do not have the outreach and the urban connection that the incorporated cities have. And I just think it develops a little bit slower. And I don't want to shortchange it.
Okay. For right now, I'll remove the motion, Mr. Chair, but I want to ask Lance this, so we could get to Rebecca's opinion. Hey, Lance, if you got a favorable response on moving forward with the second half of that 2.5 million, would that alleviate any action today on reallocating any of the unincorporated funds? Because now you're sitting on, now you know you have access to the second 2.5 million. Does that solve that issue?
Yeah, moving into phase 2 would definitely solve that issue overall. I mean, right now, City of Hanford, to be honest, I just signed off and we're probably going to top them out on the phase 1 allocation today or tomorrow. Same thing with City of Lemoore and City of Corcoran for that matter. So if we were able to move into phase 2, we could continue instead of putting a hold on it essentially.
I would just like to remind the board of its previous action on this. When it approved the business assistance program, the purpose of today's meeting was to determine whether the county had received its second CARES Act payment in order to fund phase 2. And the board reserved for its first meeting in October to see where the unexpended funds lie and then look at reallocation at that meeting.
That's a great wait from our previous conversation to October,
which is
in 2 weeks. Lance, you okay with waiting 2 weeks?
We can do that, yes, sir.
And Mr. Chairman, I think he's going to do whatever he tells us to do, but he opened up saying he needs the money now. And so I get that the board, that we did do that, and I appreciate the reminder, but the board has the ability to change that today. And so I think, I don't think it's any harm, no foul if we leave the numbers there so everyone's comfortable, but at least get an answer on where we're at to see if Lance could move forward or how much he can move forward on the second $2.5 million.
It's not our actions I'm concerned with, it's the state of California and the way it distributes the funds. And I think that's why I'm very reluctant to move those funds at this time. And I think we need to wait the extra 14 days, 2 weeks from today, to be able to make those adjustments.
You're saying you want to make sure check is in hand?
Right.
Okay, and I'm there too, but is any checks in hand, Rebecca?
We've received 3 payments, a total of $7.8 million. Right now, the general fund has a positive cash balance of $1.6 million.
Fiscally, does it hurt you if the board moved 2 weeks ahead on the 2.5, the second half for the small business? Is that a red flag?
I think it would take a couple weeks for those checks to get out. So I think the work could start, and hopefully by that time we'd receive another payment.
And
hopefully.
Requests have already been made. So everything's in the pipeline. Everything's still moving. We're not holding anything up. Everything's moving. And I just like to stay with the original plan of that first week in October.
Yeah, the state of California is kind of uncertain at this time.
Oh, yeah.
So I would be cautious. I don't disperse any money until my check's cleared.
Right.
So, out of caution, I think 2 weeks wouldn't hurt. And so, but the unincorporated money, how much is that? 800,000?
584,000.
And Lance, you don't have any people that have submitted from the unincorporated that could use that money now, or are you still waiting for applications to come in?
So we've already actually distributed 215,700 to unincorporated. We have 15 applications that are going through the review process now. It's about another 300,000, but that was the second highest allocation area by population base. But it wouldn't. We can continue to process and approve, and then as soon as the second allocation comes in, we can issue at that point as well. October 2nd would give us 2 more weeks of outreach. Staff are still cold calling businesses in the unincorporated areas as well. So we could have a clearer picture after that 2 weeks.
Okay. Can I see if there's appetite for the board to split it in half? 1 million right now? You just want to stick with the original game plan?
I still want to stay with the original plan.
Yeah, be nice if we had all the money now, but.
Just to clarify the board's prior action, you acted to approve expenditures of $5 million for this program out of the first two distributions, which were anticipated to be $5.2 million. And you were waiting until this meeting to determine whether to authorize phase two, $2.5 million, based on receipt of the second check. The CAO just confirmed for you that she received the second check and in fact a third check, creating a total receipt of $7.8 million. So
Wait till a full 15, just the first three.
So are we confused with the timeline with this reference to October?
no, the point of what you reserved for the October meeting was to see how successful the program had been in distributing the full $5 million. And if there were unexpended funds, you would look at one, potentially opening it up for nonprofit organizations and other kinds of businesses, or reallocating it for other purposes. So to the extent I'm hearing discussion that says, well, we want to wait until we get the fourth check, I just wanted to clarify for the board what your original action was.
So we should stick to the original action.
I want to stick to the original action because I'm just not sure that the flow of revenue is going to be what we projected. And so I would rather stick to the budget and stick to the game plan we have. Lance and that operation is processing all of the claims as fast as they can. The cities are doing their part. I just don't see why we need to get ahead of the curve.
And just so I understand, Supervisor, when you say stick with the original game plan was to authorize the second 2.5 million to be distributed at this meeting if you had received the second check from the state, which you have received. So whatever action the board wants to take, Supervisor Valley is correct. You can revisit that. I just want to be sure that we're on the same page with respect to what the original game plan was.
Yeah, and I'm just growing more concerned about the final payment. And so it's not anything that this organization, the county, has done. It's just I'm becoming very not becoming. I think I've always been unsure of the state's activities.
As the board should be. There are still outstanding funds that if we do not continue to engage our best faith efforts, could be denied the county. For clarity of the record, are you saying the board should authorize the second 2.5 million phase two funds to be distributed based on current applications? Or are you saying you would like to change the board action to hold up on phase two until we get further funds?
Well, I mean, it's clear that we don't have the funds to
No, we do have
allocate.
them.
We got 1.6, right?
No, we have them.
That's reserved. Yeah.
Okay.
No, we've gotten
We
three.
have the money
payments.
to finish the project.
No, I get that. So we also had a commitment of 8 million to the health department out of that.
Right.
So, I mean,
No, we're on track right now.
right.
I'm just concerned that that track's gonna come
When do you anticipate the next check?
over. Yeah, so it's supposed to be October and then we'll have one final payment. That, I don't know if that,
At the end of October.
yeah, and has that been confirmed? Yeah, you know, and that's the part that has me a little bit concerned.
Mr. Chairman, I think Lance confused us by the fact he confused me a little bit, honestly, because it was reversal of the presentation where today what he's asking for, we'd already voted to do what he's asking for today. And then we were going to come back and look at how the numbers fell. But he presented to us where the numbers are at today. And in my mind, I got confused. But out of respect for his staff and the working the last several weekends to stay on point, I would actually, Mr. Chair, and then respect the decision, but I would make the motion that this board sticks to the plan, because if we don't, his office lines are going to ring up by business owners who him and his staff have been telling business owners the second half of the money is coming on this day. And I think that it's going to lower morale in the business world in Kings County if they learn about that, Mr. Chair. So I think that I would at least put it up, at least so we can all know where we stand today. Just put it up to stay on track and put out the authorize the second 2.5, because we now have two levels of safety with the two extra checks that came in when we were only asking for one more, Mr. Chair. The stories we've all heard, business owners have picked up the check and literally cried in that office. And I heard it from those employees on Friday when I went in there, not crying because they're not men or women. They're crying because they didn't expect the county to help them. They never asked for help in their whole lives. And the one time they needed help, we were there for them. And I feel for them, and I would like to stay on point. And so that would be my motion, that we authorize the second half as planned and keep this small business grant moving forward.
We have
Respectfully ask for second.
We have the funds for it, correct?
We do have the funds, and also your board gave authorization, I believe it was last week or the week before, to borrow up to $28 million from the treasury pool if needed. So there's that availability as well.
I trust we're not going to
Motion
need
to
that.
keep it on track is where we started with in July. No second.
What, do we need a motion to
We need a
approve what
motion and
we've
a second to
approved?
continue on?
Or just let it roll as is?
To wait until we had the money. We got the money, so now we forward. So do we have a second?
Yeah, for phase two only, that's fine. I just don't want to do any transfers from the rural to the urban.
Noted, yeah, and that's not in the motion, sir. Okay.
Got a motion by Supervisor Valley, second by Supervisor Neves. Madam Clerk, please call the roll.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Okay, 5 in favor. Got your marching orders, Lance. Get it done.
Good luck.
And then we can revisit the allocation, whatever left over after we get down to the final numbers, and we can see who needs it. So, and I hope the cities are distributing their money.
Oh, yeah, they better be. Mr. Chair, before you forget again, there's one more point of order under this topic by the sheriff. We said that he asked us to have a
Oh, he wants
discussion
to
on.
talk. Sheriff, you still on the line?
I am sure still here, and I was just hoping from my public comments earlier that the board could consider my request in opening up a little bit of funds that were given to KCAO for the childcare babysitting needs through the previous program, but that no longer has funding.
And Mr. Chairman, the $2 million that the board has allocated over there, we have $2 million over there already. Sounds like why am I drawing a blank on his name? Jeff Garner. Jeff Garner. He has a mechanism there, a program that was proven successful on helping folks out around the county, public safety or not, with some of the challenges to child care here. And I would like the board to consider, Mr. Chairman, out of that $2 million that we approved under Kings County Cares, that we allow up to $20,000 of that money between now and December 31st to be used to help with these challenges that the sheriff is facing by the men and women in his law enforcement division. I get the fact that someone has already said it opens the doors to all the employees, but I think that historically this board has taken care of most of the employees who have the ability to work from home when some of these sheriff deputies, they don't. And historically, we've adapted and we modified to the fact that they are different every year when we shut down for Christmas and New Year's. And the majority of those employees get to stay home and be with their families. And the men and women of law enforcement, they do not. They're out there on the shift Christmas Eve, Christmas morning, or when the clock strikes midnight on New Year's. So I would ask that the board would consider this 20,000 specifically for the sheriff. He's asking, no one else is asking. The squeaky wheel gets the oil. He's saying there's a problem. And I would feel better if those deputies could be on shift and not have to worry about their kids are at home having to do school without them or with them, and they're missing work to be there to get their kids online or whatever. It's a problem. I want to get long-winded. The sheriff, these are his people. He explained it. He's asking for help. I think 20,000 is a small amount. I would ask the board to consider just allocating 20,000 out of the 2 million that's already sitting there for that program.
Being administered through KCAO.
Yeah, the money's already there. Jeff Garner could give us a report on how he would do it.
Okay. For purposes of clarification, that wasn't anticipated in the original contract, so we would need to amend the contract in order to accomplish that with board direction. We can certainly speak with KCAO to see if they will do it as part of the $2 million authorized program. If they will, we can prepare an amendment to the contract. It is under the CAO's signing authority, so we can accomplish that very quickly. If he determines that he needs additional funds, we will have to bring it back if he can't fit it within his current allocation. Is that acceptable to the maker of the motion?
Oh, yes. No, I assume that there's steps to this and we got to have a little patience with it. I'm just looking to get the general direction of the board to move forward with all those things that you outlined.
Very good. I just wanted to make sure that that was the way the motion was structured, anticipating you would want this accomplished at the earliest opportunity.
Yes, ma'am.
Okay, we've got a motion by Supervisor Valley. Second? Second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Out of fairness, everybody, no.
Richard Fagundes.
Yes.
So 4 in favor, 1 no. We've approved to go forward with the $40,000 through KCAO.
I'll keep the supervisor in custody till the sheriff could get here. No, I'm fine.
So we're here at board member announcements and reports. Supervisor Valley.
None. Thank you, Mr. Chair. Good to be back. Miss you guys.
Supervisor Peterson.
Yeah, very quickly, had our monthly air district meeting last week. Obviously, the fires, big impacts to air quality in California and around the West Coast. Good news with respect to funding for all of our programs. We sent or applied for grant funds through EPA. 2 of our grant requests were ranked number 1 and 2. The agricultural tractor program, we received 20 million, and low dust harvesting equipment, we received 10.3 million for a total of 30,366,000, which is going to go a long ways to continuing the tractor program. We're successful with some Prop 1B funding in the order of about $2.3 million, and that was specific to our goods movement emissions reductions program. So we've replaced locomotives, trucking applications and things of that nature, mobile sources that we don't have funding through our typical funding allocations, but a good hit, and it's the biggest award we've ever received in the district. So.
Okay, thank you. Supervisor Fagundes.
Man, you must be late for lunch.
Yep.
Good answer.
Everybody else eats on time.
Joe Cartwright ain't going nowhere.
Mr. Chair, CalViva had a meeting. The state of California, in its infinite wisdom and knowledge, thinks that our enrollment should be at 390,000. Our actual enrollment's only 361,000. So they're penalizing us $1 million a month because we don't have that market share. The organization continues to lose market share. There are some good products on the market. North California, Anthem Blue Cross, and many others. There are other organizations that are coming into California offering healthcare now. And so we're trying to do the best we can. We are not the only healthcare plan in this situation. And they have gotten together all of the healthcare plans of California, and we're hoping to have some rate adjustments in January. But we do anticipate a $7 to $8 million loss in the meantime. Attended the brown bag luncheon by way of WebEx, and staff did a great job. It's always amazing to see what staff has done over the last year. You know, and so it's good to see those employees be recognized for all of their hard work and dedication, even under these current environment. The Kings County Homeless Collaborative met yesterday. We made a small adjustment to the bylaws, and they'll be coming before us in a small adjustment. And we'll see that at a future date, as well as got updates on all of the homeless programs, as well as funding opportunities. There's a real shortage of housing units out there, both in the market and for homeless population as well. And I just don't know how you fix that. You know, there are tremendous needs, but there are also, you know, if you look at the real estate pages, there's not a whole lot of inventory. And so I don't know where that investment's going to come. State of California can't figure out how to keep the lights on, you know, with some of the power interruptions. And so, you know, they're going to have to get their utilities in line. And then also on a sad note, Keith Winkler passed away August 24th. He was a 45-year employee of Kings County, having retired as the public health director in 2017. So keep him and his family in your prayers.
Thank you. A big brief. So last week I traveled to Washington, D.C. via Zoom, and we had our.
Hold on, is that, can he legally use the word travel in that sentence?
Put in its claim. In order for the claim to work, he has to say that.
It was in the
Policy got small and then went.
Yeah, Brogan Jetson.
It was our policy council meeting, and we had, it was actually pretty decent. I was kind of against it at first, but it was okay. We had a good staff. They all spoke well. They rehearsed their lines. You know, it's monotonous when you do a group meeting because it's the same story every time you meet somebody different. So Congressman Casa, Congressman just Josh Harder. We met with the Department of Interior. We also had met with the Office of Intergovernmental Relations with William Grozier. Had a good conversation with him. We also had Tom Jordan from the Air District speak on to the EPA, and which I think had a big deal to do with the money coming to the tractor program. I know last year we were there, we spoke on that tractor program. I was in the EPA myself, and I said the last place a farmer wants to be is stuck in a room with the EPA, and you guys are our enemy. And I said, but you got to keep this program alive. And they called me back in after the meeting and talked to me, and I said, you know, I use this program. I didn't follow it at first because I thought it wasn't right, but I go, you got to keep it going now. So they understand, and it's good to have that relationship with them. So it was a good meeting. We had three total meetings over a period of a week, and I think this might be a new step in the right direction for the Zoom. It saves the county some money for travels. We're able to see the person we're talking to. Some congressmen weren't as friendly with it as others, but it worked out. Nunes and McCarthy were not able to make it at the last minute, but it was a good meeting. I also talked about upcoming plans to do reach out to our communities of the farm labor community and get them fed and get them a test kit and show them how easy it is. And I work with Gar Bennett on that, and they're going to reach out to Job Depends on Ag and bring them on board, and work with Ed Hill on that, and also the girl that works there, Darcy Pickens, and some language. So they're working on advertisements to the radio stations right now, and we'll start setting some dates up here next week sometime. Hopefully we'll do, I like to do at least one a month or more, if that, and throughout the community, and pick some places. I think, you know, over in the stockyards might be good. Be more Gar Bennett and Bennett Bennett Pump in Armona, and maybe we can reach out to Avenel too, or Corcoran, and we'll tie in the local farmers and make them involved too, and bring their staff up there. And after, as harvest gets over, more and more people will be able to do this. So I think it's good. I got good reaction from the people, and they were disappointed they weren't going to be able to have a barbecue this year. And this gives them a reason to. I said, well, you're going to take credit for doing this, and we're going to get people tested in the process. So that said, we'll go ahead and upcoming events.
On board correspondence first, we have a letter from the California Public Utilities Commission regarding Rule 20 programs. From Downey Brand, there's a request for placement of CEQA notice list for projects involving the Kings River water. From LAGS Medical Centers, that's the Spine and Sports Center Medical Center, there's a warn notice of 5 layoffs in Kings County, 113 across the state. And from the State Water Resources Control Board, there is a notice of petition for long-term change involving the transfer of up to 5,616 acre-feet of water. Upcoming meetings, the Public Safety Appreciation Lunch has moved to October 23rd. And then next week on upcoming agenda items, we'll have the COVID-19 update. We will have the primary and alternate director appointments for the California State Association of Counties. We will have from the Health Department an agreement with Pacific Union College for nursing students to gain experience in public health. Also from the sheriff, we'll have an agreement with Promedium for an online concealed carry weapons system, tracking system. From behavioral health, we'll have an agreement with the Kings Commission on Aging for senior access for engagement program services. And from human resources, we'll have a job spec for the family resource coordinator and senior family resource coordinator revisions. That's it.
Okay. This meeting will be adjourned, and we'll be back here September 29th at 9 a.m. And that's it. Thank you. Do we have meetings this afternoon? No.